there is DfE funded training for all settings to train a sorry, lost my train there because my screen's popping up with things. There's funding for all schools to train a member of staff in this role. It's a £1,200 flat rate for all schools, and there's all sorts of courses out there for people to choose from that have been quality assured. So it could be really short time ones if that's all you've got available, different levels of expertise, online or face to face. There's all kinds of there's a course for everybody, and there's information on the Gov website for people to help select the one that's just right for them. So I thought I would here probably just share. We've had a bit of feedback already because there's been the first influx of trainees who've completed the course. It only started back in October, and the feedback's been really positive. We've had over 8,000 schools who've applied for the grant, many of whom will have already received it, and 6,500 senior leads have booked up onto the course, and many of whom have completed it. And yeah, the feedback's been brilliant. So people are reflecting on their current practice. They're looking at how they can use the community to help enhance their provision, and they're recognising that it's not just their job to do it. It's a team effort to really roll out mental health in schools in a successful way. And a couple of bits of news on the senior mental health lead training is that the funding has been extended. That was announced just last month. There are now over 100 courses to choose from, and there are always new courses being assured. So that's always good news. That means you can get one that's just the right fit. And there's a new selection tool to help people choose the right one, because when the lists are getting bigger, that job only becomes harder. And the other thing that might be useful to many of you who are here, depending on your roles, is that very soon, probably think next month, we'll be publishing the list of schools who have accessed the grant and the training, so that it really helps target where support needs to go, who has had the training, who hasn't, and which schools that would apply to. So the other thing I said I would talk about, and I'm just checking my time, is the whole school college approach. And actually, I can't talk about senior mental health leads without talking about the whole school or college approach, because the role is underpinned by how that's rolled out and developed at an education setting. So it really is, to my mind, it really is the key to sustained and wider impact for children and young people. While targeted interventions are amazing, they are not the be all and end all. We want to reach, we want it to be a universal service that is reaching all young people in London. And indeed across the nation. So I imagine that probably most of you are pretty familiar with these 8 principles of whole school college approach. So rather than talk through them one by one, I thought I would just share a nice example of where there's been some really effective practice in whole school college approach to mental health and wellbeing, and also talk about how impactful it's been. So one example of a model I'll talk through is of a senior mental health lead in London who developed a multidisciplinary approach to mental health at her school by setting up weekly pastoral meetings. And these were attended by the SENCO, the designated safeguarding lead, school counsellor, CAMS, mental health support team staff. And often they would be specifically inviting outside agencies, such as you might have the educational psychologists, early help practitioners, behaviour outreach support workers, and a host of other professionals. And what would happen is the senior mental health lead, she chairs the meetings, and they'll talk through cases which have been brought to her through the school. Sometimes the really minor ones, just really light concerns that staff would have, but there was an ethos in the school to make sure people passed on all these things, because it would help build a bigger picture, and it would help that early intervention and prevention, early identification, sorry, and prevention. What happened in these meetings is it gave the opportunity for professional dialogue about the issues and possible support and actions. And these might have been anything from, well, actually, it's just continued monitoring, or maybe we're going to support the school staff with some universal offers and some advice on conversations to have and language to use. Or maybe we're going to be ensuring that the best referral pathways are chosen, and pretty much everything in between. So the school was benefiting from really specialist expertise, and services were able to share what their offer was, and they were able to ensure that that crossover in services was avoided, but also similarly joined up work was implemented where it was needed. So some of the impactful work that really came from this included things like there were whole class interventions on emotional regulation for really targeted cohorts where the children were showing common difficulties. Referrals to wider services had a far better acceptance rate because they were being better selected, and where there might have been long wait times, plans were put in place for short-term support. Parents were able to access specialist local services that otherwise the school staff just didn't know existed. So there were voluntary organisations for substance misuse or domestic abuse or parenting courses or practical things like housing support. So that all came through and fed through this multidisciplinary team. School staff had training in how to identify mental health needs at a really sort of early stage, and then later they rolled out trauma-informed practice for the school staff as well. So there was kind of a strategic CPD going on there for the staff. The behaviour policy was adapted to be more trauma-informed. Pupil voice was embedded into practice throughout the school year in a really planned out way, and it began to, thank you, okay, I'll wrap up now, and it really began to influence change. And the school had this shared language for emotional regulation, which was just something which was embedded in the school. Assemblies, events like that were all planned out to make sure there was mental health was just part of the day-to-day life at this school. So I'm just going to finish up with my last minute. I'll skip a couple of things I was going to say. I'll finish up with some celebrations though. So some feedback from one family who benefited from some mental health support work. One of them here I'll read out from a parent. Hi, I just wanted to say a massive thank you. I honestly feel like I've got my daughter back. She's like a different person. She looked forward to speaking with you so much. I'm over the moon how much this has helped. As I'm writing this, she's singing and dancing with her headphones on, and this is something so small but makes me so happy to see her so happy. Thank you again for all your support and help. And if I have time for one more really short one, it's from a member of staff in a school, which is a senior mental health lead in a primary school in London, who said, I honestly don't know where our mental health provision would be without our mental health support team and what I would do without them. And that's a message I'm hearing all over the place when I'm out and about in London in schools. So I'd just like to say well done to all those of you who are working so hard to have this impact. And I think I've just about done my 10 minutes. How was that?
Well
done, we did time collect. Okay, so there we go. Whistle stop, but there we go. I'll stop presenting.
Really helpful to have that that overview as a scene setting for the event this morning. So thank you very much for that. I'm going to move on because of time with no further ado and introduce Jackie Chin, who's the consultant in mental health for the Office for Health Improvement and Disparities. Welcome, Jackie, and I'll hand over to you now.
Thanks, Kirsty. Thanks, Ian. Thanks, Kirsty. That was absolutely fantastic and really inspiring. Next slide, please. Thanks. I just want to share a little bit of information about, just a bit of background information on children and young people's mental health. And as Kirsty has already mentioned, the majority of lifelong mental health problems start before the age of 25. And it's just a reminder, really, that children may be anywhere beyond that spectrum between being healthy and unwell, and many move along the spectrum at different times. Thanks. Next slide, please. And this slide was produced by Public Health England. It sets out some of the risk and protective factors for children and young people's mental health. So it looks at from the perspective of the child, the family, school, and community. So if we think about the school, some of the risk factors, which I'm sure you're very familiar with, around bullying, discrimination, a breakdown of positive friendships, peer pressure, and pupil-teacher relationships. But as Kirsty said, the school has a really great opportunity for protective factors. So thinking about the climate of belonging and connectedness, having clear policies, and as Kirsty mentioned, the whole school approach to promoting good mental health all have a really important role. Next slide, please. Thanks. So what were some of the implications for children and young people's mental health in the early stages of the pandemic? So a report from UNICEF shared with us, as many of you will be familiar, an increase in stress and anxiety, depressive symptoms. We saw a moderate increase in anger, irritability, and inattention, particularly in those children with ADHD and autism. We saw an increased use of alcohol and substance use, particularly among adolescent boys. There was decreased physical activity and an impact on sleep patterns. Some of the children, particularly those with pre-existing neurodevelopmental conditions and mental health issues, they actually found a decrease in life satisfaction compared to the pre-pandemic. There were mixed results on self-harm, on the impact of self-harm and suicide. And there's some figures from the NHS in 2020 which showed referrals to mental health services had increased by 28%. Next slide, please. So clearly coming out of the pandemic, the coast-based study showed that actually behavioural, emotional and attention difficulties have actually decreased as restrictions have eased. And we're seeing this much more in the 4 to 10-year-old age group. However, children with special educational needs and or neurodevelopmental disorders and those from low-income households, we haven't seen that recovery, and they continue to have elevated mental health symptoms. Next slide, please. This is a very busy slide, but it's based on the mental health survey, a children and young people survey done in 2017, and then there was a follow-up in 2020. And we saw in 2017 that approximately 1 in 9 children had a probable mental disorder. And what I mean by that is that they were highly likely to have a clinically diagnosable condition. And when this was followed up in 2020, it suggested that this may have increased to 1 in 6. You'll get the slide later, but it shows a prevalence for different conditions: emotional, behavioral, hyperactivity, and other. It also shows some of the differences in the rates between boys and girls. Next slide, please. So if we look at ethnicity and the household income, we know that rates of the rates vary between ethnic groups. So we see that the rates are higher in white British children and lower in Black British and Asian children. With regard to socioeconomics, we see that mental health conditions tended to be more common in children living in lower income households. Next slide, please. This one looks at social, emotional, and mental health needs in London and England. London's rate is increasing. It's a light blue one, but not as steep as the England line, which is the black line. And London has higher rates for pupils of secondary school age. And then you see rates for those across England are higher in the deprived areas. Next slide, please. Just got 2 more. Just looking at children who are looked after, the rates are lower in London than in England, but this recent trend shows a plateau for London, so one to watch, please. And our last slide. I know you'll be hearing, next slide, please, Erica, thanks. I know you'll be hearing about lots of resources. I just wanted to flag to you Every Mind Matters. If you haven't seen it before, please do have a look. And that's it from me. Thank you. Last slide, just Aditya. Thank you very much.
Thanks very much, Jackie. And I think we've got an enormous number of presentations. It's trying to get everything, but just to remind everybody, we will be sharing the slides because there's a huge amount of information contained within them. So thanks very much, Jackie. And I'm now going to move us on to introduce Alex Goforth. And Alex comes from the National CYP Mental Health Team at NHS England, and we're going to talk about the Mental Health Support Team's workforce update. So I'll pass over to you now, Alex.
Thanks, Ian. Thanks for the introduction, and thank you to Jessica, who's going to be changing the slides. I just wanted to apologise for the initial slide, which is quite misleading. But I am going to be talking to you about the progress that the Mental Health Support Team programme and the Green Paper programme has made so far since its inception, and some of the things that we see in its future as well. Next slide, please. So the NHS long-term plan, as you all know, made a range of commitments to expanding the services available for children, young people and families, and substantially increasing access by 345,000 by 23-24, which is obviously an enormous amount of additional children, young people being seen. And mental health support teams in educational settings are going to make a really big contribution to this by covering at least 20 to 25% of the country by 23-24. Next slide, please. Following the long-term plan, funding for children and young people's mental health services has and will continue to increase dramatically. Amounts up to 23-24 are confirmed in the mental health implementation plan. You can see in the table on the slide. And from 24-25, all of that funding for existing mental health support teams will go into the CCG or ICB, as they are now, baselines for maintaining existing MHSTs. And we hope to secure more funding to increase the number of mental health support teams across the country. Next slide, please. So the MHST programme emerged from the Green Paper in 2018-19, and at this point in time, around 399 MHSTs are either operational or in the process of being established across the whole country. Waves 7 and 8 will bring us up to 500 teams, and on this trajectory, by 23-24, MHSTs will be accessible to over 3 million children and young people and parents and carers, which is around 35% coverage, so well ahead of the long-term plan target, which is great news. This really is an extraordinary achievement, and all of us should be congratulating ourselves because it's a great piece of work, and it's been incredibly hard, but there is more to do. Next slide, please. For waves 5 and 6, we moved away from the expression of interest process to multi-year plans to allow ICBs and regions to manage their expansion over the years to 23-24 and beyond, we hope, and for regions and the central team to ensure even coverage across the country. From a workforce perspective, this also means more time for sites to recruit EMHPs and senior staff, and I really hope that this will become truer and truer with the waves up until wave 10 and beyond. There's a lot of information on that slide, but obviously the slides will be shared so you can have a closer look at that. Next slide, please. So according to the latest NHS benchmarking workforce audit report, the total children and young people's mental health workforce across the NHS and local authorities and the voluntary sector and independent sectors increased from the end of 2019 by 39%, which is over 5,000 additional whole-time equivalents, which is incredible, over 27 months. And we know a substantial part of this, again, is due to all of your work in creating and expanding your mental health support teams. But we also know that at the moment, it looks as though MHSTs are underrepresented in the data. The report highlighted marginally reduced retention from 83 to 80% between over a 12-month period between April 20 and March 21. So that means that high levels of staff turnover, about 20% on average. And given vacancies have remained at 9%, we might assume that staff are moving between employers within the sector rather than leaving altogether. Though as retention does range from between 60 and 100%, it's clear that there's scope for improvement. And obviously, you'll know as well as I do that anecdotally, and you may have experience of this, although variably, there are higher levels of turnover in MHSTs, especially in particular geographical areas. And I think this is because some EMHPs come to the end of a sort of 2-year period of qualification and they're looking for new challenges. And I suspect in London as a whole, maybe retention will be higher than other regions, though you may experience significant movement within or between ICBs. Next slide, please. So in 21-22, workforce growth in the sector could be attributed to steadily increasing numbers of EMHPs and CWPs, as well as increasing numbers of recruit-to-train therapists, clinical psychologists, and child psychotherapists. We expect all of those offers to be maintained. Next slide, please. In 22-23, workforce developments will include piloting almost entirely remotely delivered EMHP training from Exeter University, establishing career progression opportunities for EMHPs and CWPs, and a project to enhance integration and support for children and young people's mental health in primary care settings, which will definitely have links to MHSTs, as well as professional registration for CWPs and EMHPs. And we're going to begin looking at how we can professionally register and accredit CYPIAPs and recruit to train courses as well, although that is in its inception as a piece of work. And we'll be working really closely with HEE on initiatives to widen participation in the workforce, which I'll talk about in a moment. Next slide, please. Okay, that actually, one back, please. That was the slide I wanted to be talking about now. So in response to the need to retain staff, a curriculum group is currently working on a senior wellbeing practitioner training that will be accessible to qualified CWPs and EMHPs with the right experience so that avenues for career progression are clear. This new training will equip them to supervise as well as extend their clinical skill sets. And it's likely that the training will include adapting interventions for neurodiverse children and young people and their families, as well as supporting simple trauma, OCD, social anxiety, and possibly low intensity interventions for eating disorders and tics. Consideration is being given to how best to engineer the training to respond to cases that the pandemic has raised, as well as supporting existing gaps within MHSTs and in community services. It's likely that this is going to be a postgraduate diploma offered in a modular form so that those who've already completed the supervisor training can simply APEL the additional clinical practice modules. It's also our intention that the training will have 2 strands, one for EMHPs and one for CWPs, so that EMHPs consolidate their skills in educational settings and CWPs focus in the community. And this training, we hope, will be available by January 2023. Alongside this training is also an update to the CWP training to bring it from a postgraduate certificate to a diploma, to make it more equitable with the EMHP training, so to an equivalent intensity. And a top-up is also being considered to enable existing CWPs to upgrade. Okay, I was talking to the previous slide. Okay, could we go back one, please? Yeah. Those initiatives are very closely allied to the development of professional registration for EMHPs and CWPs. They will have a choice of either BPS or the BABCP, but it's going to be mandatory for all CWPs and EMHPs practicing under those titles to be registered. courses are being accredited by the BPS, and HEE's assurance of already delivered courses means that any already qualified EMHPs or CWPs will be able to register, assuming they're working in accordance with the BPS and BABCP guidelines. EMHPs and CWPs will need to be working in systems of care as defined by guidance issued by the professional bodies, which will include being provided adequate supervision, working within particular service structures, and the appropriate use of low intensity interventions. Next slide, please. So my penultimate slide relates to the importance of maintaining a full complement of EMHPs within an MHST. Some of you may have seen an email that was sent out a couple of weeks ago. Other than a few of the Trailblazer sites, all MHSTs are funded for 4 EMHPs, so the funding is there. In terms of increasing access, a substantial amount of the MHST capacity to support children and young people and families with mild to moderate conditions is based on EMHPs. And so both new and existing MHSTs have an important role in training EMHPs to fill vacancies created through attrition and through turnover of qualified staff. I know it's tempting to try to recruit qualified EMHPs, but this is going to become harder as there is a finite supply, and essentially you're just kind of borrowing or stealing from other services, which doesn't feel fair. This is especially going to be true once the senior training gets going, but it will also allow hopefully you as sites to plan for vacancies and to fill those. So the headline for this slide is that sites do have the opportunity to utilise underspend and engage with HEE and HEI colleagues about directly commissioning additional training places. And I think that this applies to supervision training places as well. So next slide, please. And this is my final one. I've probably only got a minute left. So this sets out our intention with HEE to support MHSTs and the wider children and people's mental health workforce and services to look carefully at how they develop workforces that reflect the diversities of their local communities. So this includes empowering MHSTs to recruit with their local ONS data in mind and to reach into their local communities to give opportunities to those who might not regularly check NHS jobs, as well as working closely with HEIs to utilise the opportunities afforded by graduate, which is to say level 6 and postgraduate level 7 routes into EMHP trainings. A case study of Calderdale, which is an MHST site in West Yorkshire, for those of you who don't know. Their approach to representative recruitment is on the Future Collaboration platform, and it's really interesting. I recommend having a look at that. And we're planning to gather up more examples of how sites are already doing this to really diversify and give people opportunities to access this workforce expansion. Thank you.
Thanks very much, Alex, for a real whistle stop to a huge amount of information contained within that. So thank you very much for that update. Okay, as I can see questions going into the chat, please do put more questions in, and we've got, as I say, a Q&A session in about half an hour or so. So the next presentation is from David Marston from HEE and Josie Turner also from HEE around commissioning in the London region. So I'll pass you on to David and Josie. I'm not sure which one of you is going to speak first.
Hello, good morning. Hi, I'm Josie Turner from Health Education England in the London region, and I'm going to speak really briefly this morning about how we've commissioned the role of the education mental health practitioner. Next slide, please. Thank you. So this slide gives you an overview of the psychological therapy roles commissioned by HEE in the categories of pre-registration training, new roles, and education and training to upskill existing roles and services. And you'll see that the education mental health practitioners sit within the new roles portfolio. And HEE provides salary support for EMHPs during their training year. Next slide, please. So we've commissioned a total of 249 EMHPs since January 2019, and that does include replacements for in-year attrition. And the training providers are UCL, the Anna Freud Centre, King's College London, and the University of Reading across the 5 intake cohorts that have received training. Next slide, please. So here are London's commissions split by cohort and education provider. Next slide, please. Thank you. And here are the totals by London's ICS regions, with particularly strong numbers shown for the most recent January cohort. And we do have encouraging data about retention in courses as well, despite the extremely challenging last 2 years that services, trainees and young people have endured. Next slide, please. So finally, I'd just like to share a couple of the resources available from Health Education England, including the Psychological Professions Network and also opportunities for professional development. And we have additionally funded a Children and Young People's Leadership Programme for clinicians. So that's everything from me. Thank you.
Thank you very much, Josie. Thanks for that update on the recruitment and training for staff in schools. So I'm going to, again, pressed for time, I'm going to move us on to the next session, which is Jess and Troy from Partnership for Young London. We're going to talk about the Good Thinking programme for children and young people and tell you a little bit about that service. So I'll pass you over to, is it Jess? Are you going to speak first or Troy?
Yeah, thanks, Ian. I'm going to go first, and I'm going to speak very, very briefly because Troy is the main star of this event. So for those of you that don't shake your head, so for those of you that don't know about Good Thinking, it is available for all ages. So it's an online mental wellbeing resource. It's focused around the 4 most common mental health conditions, and it was originally launched in 2017 for adults only. And then in March 2021, we launched to children and young people as well, which we were thrilled to be doing finally. So I've just highlighted some of the resources available. There's a dedicated library for children and young people. We worked really closely with Partnership for Young London throughout the design of that and what content we wanted to host. And Troy will talk a bit more about that. But we wanted to bring in some written information, some apps which we pay for on behalf of Londoners. So whereas elsewhere in the country you may have to pay for some of these premium apps, they're available for free to those who work, live or study in London. But we wanted to really focus on kind of personal stories for children and young people as well, which is why we've got some of the podcasts and blogs on there too. And then some kind of specific resources that we've launched at pertinent times throughout the year, such as moving to university, how to deal with money worries, etc. And you can see that I've just teased a couple of the 5 ways to wellbeing there on the slide. So we've worked really closely with PYL on the development of that, and the posters themselves just went live on the website this week, and we're currently working on some videos to accompany them. So I'm going to stop talking there and hand over to Troy, and bear with me because I've got to switch windows as well.
All right, I'm just going to see if this works first. Good morning, everybody. Sorry, 1 second. All right, can everybody see this? I'm sharing my screen. Can you see this, Jess?
Yeah, that's grand.
All right,
That's,
lovely,
yeah.
lovely. All right, good morning, everybody. So as Jess said, I'm Troy Norbert from Partnership for Young London. I'm the Youth Engagement Lead, and we've been spending the past 3 years working with Good Thinking, Healthy London Partnership, and external organisations such as the Reading Agency to help them understand the needs of their service users, often through research and co-design approaches to improve their mental health offers or develop new ones to meet the needs of their service users. So yeah, huge shout out to our amazing group of young people. It's been a sensitive and beautiful process growing with them, especially over the past 2 years, and I'm really humbled by their resilience and compassion for others. And what we've done is certainly something to celebrate in terms of what's been achieved over the past 2 years. I would have loved to have been joined by them because they've been incredible, but they are stuck in school or college now. So in terms of the engagement with Good Thinking, obviously us, Good Thinking and Healthy London Partnership have collaborated on many projects over the past year. This includes the Digital Health Ambassador Programme, which is a widely recognised and delivered long-term youth-led engagement programme where they review existing content and support the development of content based on the needs of Good Thinking. Also, big shout out to all of our supporters as well and colleagues from HLP, Good Thinking for building youth voice across the sector, and also the Reading Agency as well for really supporting and believing in embedding youth voice. Okay, so in terms of the 5 ways to well-being, there's been a lot of love and care been put into this from our young people, and they've been involved in shaping this from the very start, way back in August of last year. And as Jess mentioned, Good Thinking has recently partnered with faith groups across London to ensure the 5 Ways to Mental Being is accessible and relatable to all Londoners. And with the help of our digital health ambassadors and also a group of young people from Haringey, Lewisham, Newham and Southwark, we've just finished co-developing the Children and Young People's 5 Ways to Mental Wellbeing, which is centered around staying connected, being active, learning something new, giving to others and focusing on self-care. And for each way to wellbeing, we'll have a poster, which Jess has mentioned has gone live, which explains the way to wellbeing, along with suggestions on how young people can achieve it according to their interests. So we've got media, sport, food, and also faith and community. But also we'll have a series of videos, which our young experts have led on designing as well. And these will explain the way to wellbeing and offer ideas on how to get involved, and also give personal experiences from the perspective of young Londoners. We're launching these videos in the very near future, and if any school or any person on the call will be keen to access this, they'll be made available on the Good Thinking website and social media channels. Okay, and then the next bit is on the reading role list. So over the past 5 months, Partnership for Young London, the reading agency, have been bringing together young people aged 13 to 18 from London, but also across England and Wales, to inform the development of the new reading role list, which since 2013 has supported over 1 million children and young people, but it needed a bit of a makeover so that we can make it better for young people from all backgrounds and diverse contexts. In total, we've engaged around 16 to 17 young people, which sounds like a lot when it comes to co-production, but we understand young people's time is limited and some may have exams or work going on. And our experts, our young experts and health professionals have informed the whole thing. What themes we're covering, the design of the webpage, marketing, what books have been selected, everything. And I was really happy in terms of recruitment of this. A lot of this has to do with the support from the regional youth units in the Northeast, Northwest, but also representation in terms of second language speakers as well. And we worked very closely with the Indo-American Migrant Refugee Organization and also Wales cohort as well. And what I can say in terms of the current development of the scheme and expected launch date, you can view the old list on the Reading Agency webpage, but there are no new resources available at the moment as it's still being developed. But we will make an announcement at the end of May for when schools and libraries can pre-order this. And also usually publishers are very happy to support the promotion of the scheme as well. So if people on the call want me to provide a contact, then I can get in touch with them later on once the book list has been finalised, and see if authors are interested in promoting, holding an event to promote it. I guess in terms of, so this is a picture of me seeing as a schools event. So in terms of reflections of co-production, there's a massive appetite to serve for young people. Moving online isn't all that bad, but there's still value in in-person sessions. And if you are doing a hybrid approach, then if you're going to do an in-person session, then don't wait longer than a week to sorry, I just missed my point. And then just in terms of events like this, like celebrating, we need to do something like this in half term. Young people have got to be here to celebrate with us, and yeah, without their commitment and leadership, the health space wouldn't be as equitable, and their input has really helped breed enthusiasm for co-production across the health space. So thank you so much. Drop me a message if you want to chat about how to replicate the co-design process or want any access to the resources. And yeah, thank you. I hope that's been less than 10 minutes.
Thanks very much to both of you, Jess and Troy, and people have been putting questions into the chat. I think some of them have been, we're getting answers for some of them, but thanks very much. Really good to hear about the co-production and the resources that are available through Good Thinking. I know somebody asked about when the comfort break is. It's 10:33 on the agenda. I think we're about 1 or 2 minutes late, so probably about 10:35 for the first comfort break. So I'm going to introduce Susie Griffiths, who's going to do a presentation on social prescribing. So without further ado, I'll hand over to you, Susie.
Many thanks, Ian, and hi, good morning, everyone. So yes, I'm a project manager within the Healthy London Partnership Personalised Care team. I've been working on social prescribing now for about 5 years, and it's great that we've really sort of evolved in terms of the evolution of social prescribing in London. I'm here today to talk about opportunities for spreading social prescribing for children and young people. So yeah, let's move on. So I'll just briefly recap on social prescribing. What is it? It is very much a sort of an NHS term, but obviously I think there is sort of more growing widespread awareness of what social prescribing is and what the benefits of it are. And ostensibly, social prescribing is a process by which health and care professionals refer patients to social prescribing link workers to address their non-clinical needs and to help positively impact their health and well-being and emotional health and well-being by addressing the sort of social determinants of health. Social prescribing link workers are there to give people time to talk about what matters to them. So it's about shifting the conversation away from a traditional health medical model with what's the matter with you, to actually moving that conversation to a more person-centered approach to find out what really does matter to that patient. And the link workers really do help connect people with community-based organisations, connect them in with their communities, get them connected in with activities that are going to sort of boost their friendships and physical activity, being outdoors, and address sort of social isolation. And also importantly, they're there to give real practical help and advice and advocate on behalf of patients that have issues with issues such as around finance, housing, employment, social welfare and legal advice. And certainly during the pandemic, these problems have been very much exacerbated, and the link workers have been really pivotal in terms of supporting people who are facing really sort of complex, really challenging issues, particularly with sort of finance and housing and welfare legal advice. And social prescribing is intended to support but not replace formal healthcare resources. And absolutely, people do need still to access, medical support, but social prescribing can be there as a sort of an additional boost to help people manage their clinical needs a bit better. So let's move on. So social prescribing has been mainstreamed by the NHS since 2019. This is it was one of the sort of key long-term plans, sort of policy commitments, and there's the Universal Personalised Care Model framework, which was launched at the same time back in 2019. In London, there are now social prescribing services based in all of the London boroughs, and there's more than 350 link workers covering the 200 primary care networks in London. And it's important to note that social prescribing link workers are based in primary care, but they are often hosted by voluntary community sector organisations on behalf of the primary care network. So they're very much rooted in communities, and they know the local community infrastructure and the best way in which to support people. And at the moment, the majority of social prescribing link workers receive referrals from GPs and GP practices, ostensibly, but I think there is plans to hopefully broaden that out so that a wider range of healthcare professionals can refer to the social prescribing link workers. So what I'm here about today is to talk about the opportunities for expansion for children and young people, because at the moment the vast majority of social prescribing services in London are only available for adults, so 18 plus, when absolutely it is the ambition of the personalised care framework to deliver whole population approaches to supporting people of all ages. And so there is a real gap in access and equity of provision for children and young people, which does need to be addressed. And it is very much an emerging area nationally, and there's a real growing energy and commitment to develop new approaches in London. And it's fantastic to hear about the work of the mental health in schools teams, and it sounds like they're actually doing quite a lot of social prescribing themselves in their practice, in terms of getting children and family support with the social determinants of their health. And I think that it's important to note that social prescribing should be a universally accessible service, but I think it can also be particularly very much effective at particular cohorts of young people, so those with long-term conditions, absolutely mental health, those who are at risk of youth violence, those who've got learning disabilities and autism, and also thinking about the transition points, and particularly those young people and children who are perhaps in between adults and children's services, or are within sort of the statutory services and looking to transition as well to different to adults models. Yeah, let's move on. So over the last year, been working sort of strategically with NHS England, the Greater London Authority, as well as our London Voluntary Community Sector partners of Partnership for Young London, absolutely, to kind of develop a sort of London-wide common shared ambition for how we can support the rollout of social prescribing for children and young people. And we've sort of got a bit of a roadmap of what we want to try and work on over the next sort of 3 years to hopefully achieve the London ambition to have children's social prescribing happening in every borough by March 24. And it's great that there's going to be some funding from NHS England London region coming online this year to support further pilot work in boroughs around London. And we really want to try and align the work with the children and young people's integrated care models and the sort of improvement work which is going on across the whole of the London system. So next slide, please. So in terms of the current landscape in London, there's great activity happening already in a number of places in London. And I think in North East London, they did some fantastic work last year in terms of creating the momentum to do some piloting in 6 of the boroughs there. Waltham Forest have just launched their early year social prescribing project. So that's a partnership between the adult social prescribing service and a local children's centre to really reach out to parents with young children to offer them sort of social prescribing support. There's work going on in City and Hackney and Redbridge and Newham. There's social prescribing pilots happening in Enfield and Islington, which were funded by public health teams. And so basically there's stuff already happening, and we really want to try and build on this momentum to mainstream across London. There's also a lot of interest from paediatrics teams in the NHS hospital trusts and mental health trusts as well. Next slide, please. So just finally, some key considerations to think about, and it's really important that social prescribing is seen as this process and is a mechanism for linking in all the different agencies that work with children and young people. And absolutely, it's fantastic to see the work of the children and young people's mental health and schools teams and the practitioners, and it's vital that any sort of social prescribing link workers link up with those teams to really sort of holistically support children and their families with their physical, mental, emotional health and well-being. Very much social prescribing for adults. It seems like it's a very different model that is needed for children and young people, because perhaps children and young people don't access primary care and the healthcare system in the same way as adults. So really need to consider the local infrastructure and population health needs in terms of the models and pathways that are set up. Absolutely critical to be working with local authorities, schools and the voluntary community sector on this to join the dots. It's not about setting up anything new necessarily, but how our services can be better integrated and aligned. I think it's really important to think about what different service models for different cohorts. So you'd be looking perhaps a more family holistic model for families with younger children, like the Waltham Forest model, whereas social prescribing link workers can and absolutely should be working directly on a one-to-one basis with perhaps older children, young people. So the 10 to 25 age group. But and also finally, it's really important to map what is already out there, and we know that there's a great range of activities and services available for children and families in communities, in the children's centres, the youth organisations, arts and culture sector, sports and leisure facilities, and I think it's important to stress that already much of what they do is social prescribing, but not necessarily called it. And so I think it's just about how we can really ensure that there is this kind of widespread knowledge and understanding of what social prescribing is and how it can really benefit the whole population in London. Thank you very much.
Thank you very much, Susie, yeah, thanks very much. Really interesting presentation. Okay, so I think we're going to go to a comfort break. With if we take 5 minutes, so if we come back at that makes it 10:39, and then we'll reassemble for questions on the presentations that we've had so far. So I'll give you the time for a quick break, and see you in a few minutes. Thanks very much. Hi everybody. I think 5 minutes has elapsed, so hopefully people are back. And Colette, I can see you on screen. Are you going to do a quick presentation on the Mental Health in Schools toolkit?
Yeah, thanks, Ian. Sorry, this was agendaed for before the break, but we thought we'd just give people a break at the appropriate time. So just really briefly, I just wanted to show everybody our school's mental health toolkit. So for those that don't know me, hi, I'm Colette Roach. I'm the new Senior Programme Manager at Healthy London Partnership for Children and Young People's Mental Health. Hopefully you can see my screen. I've just popped the toolkit up on screen here. So this is our newly refreshed schools mental health toolkit. We've recently updated this toolkit with some new resources and kind of reorganised the content to make it a bit easier to navigate. So you might have seen a previous iteration of this, but this is the kind of new and improved version that we've got here. So what we've done, we've kind of curated hubs for different audiences. So we've got advice and resources for children and young people, for parents and carers, and for education settings, as well as more general information on mental health and kind of resources specifically for mental health support teams as well, and our communications, all organised here. I won't take you through all of it because there's loads and loads in here. We'll share the link afterwards so that you can have a bit of a look in your own time and hopefully find some useful resources. But just to highlight a few sections. So if I click into the advice and resources for children and young people, we've got lots in here. So you can see here we've got things on anxiety, stress and depression, ADHD. We've recently just added sections on faith and mental health, LGBTQ+ and race. So as an example, if I click into the faith and mental health one, you can see here, we've kind of arranged a number of resources across different faiths. So either you or children and young people that you support can go into this toolkit and kind of hopefully find some useful resources to support more specifically with, you know, your own kind of mental health and wellbeing. If I go back, similarly for race, so we've got a whole section on race and mental health. There's lots and lots in here. I guess it's useful both, again, for children and young people themselves, but also for us as professionals working with them. So, for example, section on how to be an ally, dealing with racism, mental health. So there's lots and lots in there. And then I will just quickly show you, if I go back, advice and resources for education settings. So I know a number of people on the call today will be from education settings or working with education settings. Again, hopefully this is really useful. We've got lots and lots on here: primary and secondary school teaching resources, SEND and community paediatrics. So yeah, there's tons on there. We will circulate the link in the chat and also afterwards. If anyone has any kind of suggestions or things that they think we could add to this, we're always really keen to hear and are constantly updating this. But yeah, it's just to put it on everyone's radar and hope that you will find it useful.
Thanks very much, Colette. So the next section was an opportunity to ask questions. I've been keeping an eye on the chat as much as I can because there's been a lot of activity in the chat, and some of the questions have been answered. But I remember one question that came from, I think it was Margaret, quite early in the session, around training for all of the staff in education settings, and whether there was availability for that. And I don't know whether Margaret's still with us, but so nor do I know whether Kirsty is still with us. And hi, Margaret.
Hello, sorry, yeah, no, I'm still here. I'm a parent carer of well, he's an adult now, but he suffered a severe psychotic episode at the age of 17. And in hindsight, after we'd spoken to the doctors, the signs and symptoms were there, but as parents, mental illness wasn't on our radar at all. So we had no idea. We thought he'd turned into a stroppy teenager and the hormones had kicked in. And for about 18 months, he was obviously showing the signs. And I just feel that it's all wonderful that you have mental health leads in schools, but a child like our son would never have been referred to the mental health lead unless his teachers had spotted the signs and symptoms. And we did actually go into the school about 6 months before the crisis because we were concerned about what was going on. And his head of year and his tutor didn't have a clue. Whereas I feel that, I mean, since then, I've actually done a course in signs and symptoms of mental illness. And I just feel that if all staff have rudimentary training in spotting the signs and symptoms, it might have been recognised early on.
Yeah, Mark, I'm so sorry for what your family have gone through there, Margaret. And I think that actually, sadly, it's probably not an uncommon thing. And actually, what you're talking about there is something that I certainly be a huge advocate for. And that's really one of the things we're pushing for when I talk about whole school college approach. But it has to stem from somewhere. You can't just talk about an initiative like this. It has to stem from somewhere. So something like training a senior lead to oversee it, is their role is to facilitate this kind of thing across the setting they work at. So it's their role to sort of wave the flag of mental health and get the senior leaders saying we want to train our staff. It isn't part of a statutory safeguarding training. Safeguarding training is mandatory in all schools, but that is very much based around things like keeping children safe and education content. So the content of that is quite dictated. And so then really it's the prerogative of the school to prioritise mental health. And that is what we're trying to do through a whole school college approach and get that out, not just to school staff, but to parents as well. Again, that's another element of the 8 principles, is to run sessions to raise awareness amongst the parent community as well, and the peers spotting things. And so the example I gave of the school, I'll try and answer quite quickly. The answer I gave for the school, one of the things they want to do is changing that ethos so that even the small signs are recognised, and then this is held by this team. So even something as small as this child's just not themselves. They used to be someone who participated loads, and now they're very gone into themselves. They're falling out with their peers. Even really small signs like that are the kinds of things that are being escalated up to create a bigger picture to a pastoral team of expertise who can then try and troubleshoot and get the right support in place.
Were completely the opposite. He became completely.
I was going to say other examples of the
inflated ego.
Could have said that. Yeah. There's all sorts. It's a very nuanced thing, and it's not a strict science, which is why it's so complicated with mental health. But the more people are trained and aware of it, and the more it's prioritised in schools, the better it can be. So it can't be part of. It's not a mandatory part of safeguarding training, but it's something that we're pushing the school to do.
I just feel very strongly that. Even if it was just a half-a-day workshop that's run alongside safeguarding training, schools in their policies, as well, I'm a school governor as well, it's the school's responsibility, one of their responsibilities is safeguarding the mental health of their pupils. And I just find it amazing that it's not done alongside.
Exactly that. And that's why we need to get education and health working together. The point I was hoping to make in my presentation is that there's all this expertise out there, but we've got to join it up, and schools are the perfect place to facilitate it. I'll stop because I realise time.
Okay, Alex, you've got your hand.
Just to add in response to that question, Margaret, Department for Education has funded over the last 2 years a programme which became known as Wellbeing for Education Recovery in response to the pandemic and the kind of surge in mental health conditions amongst children and young people, to train up all educational staff so that they're aware of the kind of signs of mental health conditions, and they know when to help and when to kind of wait. So that is a programme that's being funded and rolled out across the country over the last 2 years. So your local schools should be able to access that, and if they haven't, let us know and we can try and work that out.
Thank you. Thanks.
Thanks. I'm conscious we just don't have time to answer all of the questions that you've got. Nina, I don't know whether there was anything immediate that
There's a few questions, couple on good thinking, just whether there's any sort of recent stats about how good thinking is being used, as well as just a little explanation on how it was founded. I don't know whether Jess wanted to talk about that. And then there was another question just on social prescribing, and I guess a suggestion rather than a question, but it might be nice to get Susie's sort of thoughts on this about how might we raise awareness of social prescribing within schools a bit more.
Okay, I'm going to go to Jess. I think if Susie, if you could answer that in the chat, that would be, because I'm just conscious of time. Jess, do you want to just answer quickly around social,
yeah, of course,
around good thinking?
And you all saw the excellent service from my husband as well then, just as I came on camera and the coffee was delivered to me. So good thinking, I mean, it is a bit tricky for us to capture data because when it was first launched, a lot of what we heard from people around what they wanted is that they wanted an anonymous service, so something that was available 24/7. So we are fairly limited. We do get kind of Google Analytics data that kind of profiles the age range of people that are going onto the Good Thinking website. And then from the specific apps that we have for children, young people, we get more detail through those app providers about the people that are using it. So off the top of my head, I don't have like numbers to give you, but I think across all of the apps in the first year that they launched, we got up to about 2,500 users across all of the apps that had been downloaded. So that's really good. And in terms of how it's founded and funded, it's a joint enterprise between local authorities and CCG. So it's both a kind of public mental health prevention, but also NHS funded and signed off and advocated as well. I can try and pick up other things in the chat, but because I'm sharing slides, I can't keep an eye on it too much. So if there's anything else that I've missed, I can come back after the event maybe.
Okay, thanks very much, Jess. So I'm going to pass over now to Sheena to chair the next part of the event, and hopefully that sort of overview of many of the national picture will have been useful. And I think we're going now to a more sort of London perspective around mental health in schools support. So I'm afraid it isn't the time for another comfort break. And I'm going to pass you over to Sheena to chair the next session. So thanks very much.
Thank you very much, Ian, and thank you very much, colleagues. Yes, unfortunately, there's a little bit more to go before another comfort break. So we've got another 6 quickfire presentations for you, just so in terms of timing, and then we're aiming for another break at around 11:40. So just to give you a bit of a sense of time. So without further ado, I'm going to hand over to Dale from North East London ICS, who's going to kick off this next section for us. Thank you, Dale.
Thank you. Yeah, I'm just going to speak about it from an ICS perspective, that's okay. So next slide, please. I won't go into too much detail, but you heard about the ambition to reach 25% of schools and go beyond that given kind of COVID. So we're kind of in the ICS sitting around 40% in terms of pupil coverage by the end of 23-24. One of the challenges, it doesn't reach all schools, it doesn't reach all pupils. So how do we utilise what we've been given in terms of investment in workforce, and how do we make sure we are reaching further? Reaching further by thinking about the mental health support team model, and thinking about how we work with partner organisations, voluntary sector organisations, and how do we get people to kind of work differently? Because if we keep doing more of the same, we're never going to get to that kind of whole school support. Next slide, please. So our challenges, as I've just spoke about, reach. Local context, we have a very kind of diverse population in North East London, so each borough has certain aspects that we have to really think about. How do we work differently? So City and Hackney, for example, they've got a big Jewish population, so thinking about how we work with them differently, and how we kind of mould and adapt what we do. There's a big kind of youth violence aspect, so schools aren't always kind of the best place to engage young people like this. So how do we work with youth workers, etc., to kind of collaborate a bit more? How do we shift away from those schools that volunteer for mental health support teams as well? Often those schools have been on a great journey already, done some great work, but it's often those kind of quiet voices that don't volunteer as much that are often so overwhelmed by need but the idea of getting involved with something like this would be too overwhelming. So how do we gently build those relationships and get involved with new schools that aren't likely to volunteer? No one's going to be unaware of the demand in mental health. It's increased huge amounts, especially during COVID, and has kind of separated those inequalities even further. So how do we think about targeting different things, different groups with different vulnerabilities, but how do we make sure the mental health support team model isn't just at low end? How do we kind of upskill each one and every one of the team to work in different ways, whether that's through DBT, group skills, working in special interests such as LGBTQ, children that aren't in education, and how do you really kind of support them to go off and get further skills, but also give them enough time to do the additional kind of special interest work? And how do we challenge a system that is kind of driven by attainment? You can probably all speak to some areas that where wellbeing is seen as secondary, but how do we shift that culture? And it's like this conversation around trauma-informed practice is really helpful in thinking around behaviour is communication, and let's not kind of be punitive and put consequences on the behaviour, but how do we look for an opportunity? How do we see that behaviour as a chance to connect them with the right support? Listening today, thinking about the social prescribing, how do we use that space, and how do we look at behaviour as early indicators of psychosis, which Margaret mentioned? So how do we make sure mental health support teams and then specialist CAMs don't have that bigger gap in the middle? How do we work differently, shifting away from that training gear? Next slide, please. Opportunities. The best thing is we have done is prioritise co-production. There's nothing more powerful than the voice of pupils, parents and teachers. They live and breathe pupil wellbeing. How do we foster kind of getting those voices? So we've had big conferences, all about me for the benefit of everyone. It was a reverse conference listening to the good, the bad, the ugly in the ICS, and we've developed some great recommendations and a mandate for what we want to work in the way that we want to work. I'll pop it in the chat in a minute so everyone gets to speak, everyone gets to see it. But when we start schools, how do we foster that from the minute we start? So encouraging people to do listening activities before we even speak about interventions, and that pupil voice, parent voice is on that whole school approach circle. So how do we kind of make sure we keep that co-production key? We've been in health systems for years, so we get a bit blinkered. This is the way it's always done. So the people who are going to change it are the people kind of experiencing it. And especially thinking about the peer workforce and how we get young people, parents involved in a system like this. Surveys as well, kind of constantly engage, constantly adapt the mental health support teams, because what was on paper, 2018-19, it developed so much and will develop so much more. So one of the exciting things about being in a startup world is you get to adapt and a change, and you won't look the same as you did a few years ago. As I mentioned, the reach, like what are those opportunities to look beyond the single schools? The whole school approach, there's no reason that we have to think about delivering every single session in a single school. How do you create communities of primary schools to look at their whole school approach together, or a geographical area? So thinking about the pupil flow between primary, secondary, potentially into college, like how do you build those relationships? And that's how we're going to kind of reach further to make sure we're not doing necessarily individual work, we're thinking about a whole system. And thinking about schools and community, like not every pupil wants support within the school. How, and the only way we're going to reach and support different communities is by understanding their needs, their wants, their experience of mental health. So find out every voluntary sector organisation in your borough, find out who does what when working with Black and African families, thinking about the new Ukrainian families, how do we support them? Are there existing networks that we can speak to? LGBTQ, we've realised in one of the boroughs we don't have anything, so we're currently listening to find out what people want. Next slide, please. So many opportunities as well. Mental health support teams is a great space in terms of relationships around schools. So thinking about specialist training, get your MHPs, different trainings on kind of different programs, so they can be an expert within their own right. Thinking about psychosis, LGBTQ, SEND, etc., and give them the opportunity to practice in that way. Some digital opportunities there, so thinking about Luminova, podcasts, social media, and how we might digitize the whole school approach. Thinking about some of the okay, thanks. And thinking about some of the population health, so thinking about initiatives such as Empathy Week, Represent Radio. How do you reach all kind of schools and pupils without the kind of limited resource of a mental health support team? Next slide, please. That what? Yeah, I feel that's me done. Thank you.
Thank you very, very much, Dale. It's really interesting to hear about some of the local work and opportunities, particularly things like the digital offer, which is really important. Thank you very much. Next, we have Jane from Barnet Resilient Schools. So over to you, Jane.
Thank you. Morning, everyone. Yes, I'm Jane Abbott and I'm the Children and Young People's Mental Health Leader and also run the Resilient Schools programme in Barnet. Thank you. Next slide. So we were part of a pilot project for 5 years, fully funded by the CAMS transformation plan, whereby, you know, knowing that schools are in the best place to support children to be resilient and mentally healthy. Next slide. So you can see here quickly, and I'll run through these really quickly, that we have progressed from our initial 5 schools right up to 77 schools this year, and more joining, ready for the universal phase, which starts in September. Thank you. So breaking down at the moment, that's 77 schools. We have 50 other schools in Barnet that we can ask to join on that uptake. That breakdown includes 56 primary schools, just under half of our secondary schools, and most of our special schools. Thank you. We very much sit in that getting advice, and Barnet have adopted the Thrive model in looking at mental health services, and we sit in that getting advice, but we do move into getting help, but we commission Couth and Quell and work very closely with our Barnet Integrated Clinical Service. Thank you. And alongside that, we work in partnership with all of our services in Barnet, including the voluntary sector. Resilient Schools was at the very beginning of the bids for the education mental health support teams, and I sit on the board for that, and also the Safeguarding Suicide Prevention Board, our mental health board, and working very closely, obviously, with schools. Thank you. So the aim of the programme is very, very simple, and we very much stick to this aim. It is about raising awareness and destigmatising mental health and helping those school communities recognise their own and other people's mental health, and then be confident to seek support for themselves and others. And as Margaret said, you know, everybody recognising those signs and symptoms, and then being able to know that there is a mental health lead or a mental health first aider, and through this awareness be able to intervene early, and we can prevent that escalation of poor mental health. Thank you. So in its pilot phase, we tested out a huge amount of resources and interventions, but at the moment, as it stands into our universal phase, it's very much a toolkit. And we know that schools are in different parts of their journey, with mental health and that whole school approach. So we offer a huge amount of tools that they can take, but if schools want to evidence and have a kite mark of the resilient schools, they would need to complete those core components at the top, which I'll go into a little bit more detail in the next slide. Thank you. So these are the core components. We have a mapping tool that I'll show you in a second. We have that mental health awareness, and there we ask that they do deliver some mental health awareness to staff, that they deliver mental health awareness to pupils, and offer some parent training, that they have at least one mental health first aider, that they promote Cooth and Quell. Quell is our online text-based counselling for all staff in education in Barnet, that they put the self-harm and suicide document within their safeguarding or wellbeing policy, and that if secondary schools start to promote awareness of the impact of the digital world on mental health, and we've commissioned a co-produced campaign film with youth in our local area. Thank you. So this is the mapping tool. Again, you can see, which has become very familiar this morning, our whole school approach, and we look at key strengths and challenges using it as a reflective piece. Thank you. And just quickly to show that to draw schools in, we link that very much to an Ofsted inspection. So ask a key question around each component, each principle of that whole school approach. Thank you. And we can go over, you can see each one. I just put that in the slides for you to look at another time. Thank you. So one of our key successes has been the youth mental health first aid. And covers all mental health disorders, and also the crisis situations of suicidal behaviour and thoughts, panic attacks and acute psychotic behaviour. Thank you. So far, we've trained, we have 191 youth mental health first aiders across 89 schools, and we also have already trained 32 young people to be peer champions with the same training. Thank you. And I think the reason it has been so successful, for some people who don't have much knowledge of mental health, you can see a huge increase in confidence and knowledge. But actually, if you look at the left-hand one, those that do have some knowledge of mental health also increase their knowledge, confidence. And this is really key, isn't it, to staff being able to recognise signs and symptoms and be confident to use the right language to support young people. Thank you. These are lessons learned. I think I've gone through this really quickly, so thank you. And I'll leave that for you to look at a later stage. But going into our universal stage, next slide. We'll be delivering mental health awareness through the school, looking at a commission service, an online broad look at signs and symptoms so that all staff in school can recognise signs and symptoms, and then looking at how that works and whether we send that out for parents, that we use the Resilient Schools logo so schools can be recognised for their achievements, and that we are commissioning peer champions, and we continue to work with schools and look at those evidence and outcomes. How do you evidence a preventative approach when you've actually prevented something? So really looking at how do we start looking at what we've, achieved. And that's it. Thank you. A quick whistle stop tour.
Absolutely, Jane. Thank you very, very much indeed. Some really fantastic work and engagement that you've kind of shared with us today. There are some questions in the chat for you, Jane, if you're able, if you have a moment just to be able to respond
Sure.
to. And likewise with other presenter colleagues, if you get a moment, would you mind just having a look in the chat to see if there are specific questions for your presentations, and if you're able to respond. And if there's anything you'd like us to respond to, please do let us know. But if there are specific things, it'd be really helpful if you could just reach out to colleagues. Thank you. So you'd mentioned, Jane, in your presentation, you talked about Cooth. So we now have Eleanor, who's here from Cooth to help us with understanding a bit more about Cooth. So Eleanor, over to you.
Hi everyone. Yes, thank you so much for having me. So I'm just going to provide a overview this morning of our support Cooth, how we work with schools to raise awareness of our support. Next slide, please. So Kooth is a free online service.
Oh, Eleanor, sorry to interrupt that. I think if we can just mute if people aren't talking, because there's a bit of an echoing going on and we're missing really important things that you're saying. Thank you.
Thank you. So yes, for anyone who doesn't know, Kooth is a free online service offering emotional and mental health support for children and young people. So it's a website, kooth.com, and on there is a whole range of different support that young people can access if they are ever struggling with their well-being. Next slide, please. So Kooth was founded back in 2001 with the aim of trying to break down the stigma attached to mental health services. So all of our support is completely free for young people, it's safe, and it is anonymous. And what's also really great is there is no waiting lists. A young person can sign up today and get support that same day. And there are no thresholds. So any young person, no matter what they're going through, can sign up to Kooth and get support. And young people can self-refer themselves simply by going to the website. They can sign up by themselves today. The support is available every single day of the year, and all of our counsellors on Kooth are trained, qualified and BATP accredited. So we are commissioned actually throughout the UK, and this map here shows where we are currently commissioned. But what is amazing is we are available in all of London's boroughs for young people from the age of 11 to 18. And actually in many boroughs, we do also go up to the age of 25. Next slide, please. So on Kooth, we offer a whole range of support for young people. So we really give young people, that choice to choose what support is going to work best for them. And as I said, all young people on Kooth will be anonymous, and we do find that really gives them that confidence to speak out and get support without that fear of being judged. So to give you a quick overview of our support, firstly, we have self-help resources on the website. Young people can come on and set and track goals. They can keep a journal and track kind of day-to-day how they're feeling. We then have our community support, so young people can come on and have discussion boards and talk to other young people on the website, get support and advice from them. They can also learn different kind of self-help wellbeing activities and get support from peers on Kooth to help them engage with those. And then we have a magazine page where young people can read articles on loads of different topics and also actually contribute to the magazine themselves if they want to share their experiences and their support. And finally, we've got our practitioner intervention. So young people can come on and have a live one-to-one chat with one of our practitioners. Alternatively, they can drop a message to our inbox and we will get back to them with support within 24 hours. Next slide, please. So last year we released a report specifically looking at the mental health of London's children and young people. The link to that is there on the right, so I really encourage you to check that out if you have the time. But just some kind of key highlights from that report. So we found that the proportion of children and young people presenting with suicidal thoughts, self-harm, school college issues and eating difficulties was higher in London compared to the rest of the country. And there was almost a 25% rise in under 80s in London presenting with school college issues when compared to the previous year. And in London alone, new registrations to Kooth rose by 33%, with 49% coming from young people from Black, Asian and non-white backgrounds. And actually in the last 12 months, we've had nearly 17,000 registrations in London alone to Kooth. So really seeing, a big increase in young people accessing our support. Next slide, please. So a lot of the work we do is kind of working alongside schools and mental health support teams to really raise awareness of our support. So I've just picked a couple of examples here of the type of work we can do. So one of my colleagues has done some collaborative workshops with, thank you, with Hammersmith, Fulham, Ealing and Hounslow Mind. And from this, they presented to 12 schools, helping to reach over 1,000 young people and raise awareness of mental health and support. And they've got, I know, future workshops planned for this year. One of my colleagues has also done some joint work with MHSTs and Mind to circulate Kooth information to all schools. So in Hounslow, this has increased the number of engaged schools using Kooth support and there's a significant increase in new registrations. And with Wandsworth and Westminster Mind, their MHST only covers, half of the schools in Westminster. So doing this piece of work has ensured, all schools in Westminster are, aware of what support is available to them and all young people can access some mental health support. Final slide, please. So if you would like to get in touch with us to discuss, how we can support your school, your team to really embed Kooth, I would please ask you to fill out this form. I'll also pop it in the chat, but it'd be amazing to discuss how we can support you to, help all young people be aware of the support and access support for their well-being. Thank you so much.
Eleanor, thank you very, very much. There's a lot of energy in the chat, and there's some very specific things that are being asked of Kuth if you get a moment to respond to those. Really helpful, thank you. Without further ado, we will move on to a presentation from Place to Be, and presenting is Jacqueline and Cecilia. So over to you both. Thank you.
Good morning, everybody. Thank you very much for allowing us the opportunity to talk to you today. I'm Jackie Vaughan, I'm the Regional Director for London and West. My colleague is Cecilia Corbetta, and she's the Regional Clinical Lead who will be talking in a moment. So thank you. First slide, please. So a little bit about who we are. We provide mental health support within school communities. We provide a holistic clinical service, which includes training, development and research. And we work across the school community, working with pupils, school staff and families. And Cecilia will talk a little bit more about some of our offers that we have in a little minute. Our delivery is underpinned by evidence-based approaches to therapeutic intervention. And like everybody, we've seen firsthand that children's mental health and well-being has been an area of significant concern since well before the pandemic. Next slide, please. So against this backdrop, colleagues here and across London have continued to provide crucial and life-changing support for children and families. And we've had to adapt and innovate like everybody else with regards to around the pandemic. And these are just some of the achievements that have happened through our schools this last year. So at the moment, we are in 400 primary schools and secondary schools, and we have provided support to around 225,000 children and young people throughout the pandemic and across all of our UK regions. Next slide, please. So what we've seen with our young people, we've seen a 40% increase in self-harm and 26% increase in those who have suicidal thoughts compared to our data of 1920. And we've seen these figures growing throughout this academic year, with our safeguarding concerns increasing by around 54%. However, we have seen signs of recovery in our school communities. And so some of the positive impacts that we have seen for our children and young people after one-to-one counselling are around 65% of our children, their difficulties had less impact on their learning. 74% have fewer fixed-term exclusions whilst they had counselling. 79% of those with severe difficulty showed an improvement in mental health, and 74% of pupils showed an improvement at home. Now I'm just going to hand over to my colleague Cecilia, who's going to talk about sharing our learning and our ongoing development and our improvements. Thank you, Cecilia.
Thank you so much, Jackie. If you can have the next slide, please. So this slide gives you a brief overview of the presenting issues that children access in place to be supporting primary schools present with. And during and since the pandemic, we've seen a significant rise in the number of children who present with anxiety, both in primary and secondary schools. And as Jackie mentioned, we've also seen a significant increase in cases of disordered eating, as well as self-harm and suicide ideation. Next slide, please. And in our secondary schools, we've seen a change in terms of the complexity that the young people present with. And this is again specifically linked to young people who present with self-harm and suicide ideation. So we've introduced a new risk assessment and safety plan process for all of our clinical staff to add additional safeguards. And we've also strengthened our clinical offer by adding a CBT-informed intervention to our service model in secondary schools. Next slide, please. So I'm now going to say a few words about key developments in our service provision, which have enabled us to both add to our service model in response to users' needs and research findings, and to increase our reach by utilising a digital approach. So a key part of our work is to support significant adults in children's lives as part of our whole school approach to mental health. So we recognise the crucial influence of teachers, parents and carers on children's experiences and achievements. And working with teachers has always been a part of our service offer. But what has changed during and post the pandemic is how we support and train teachers. In August 2020, we launched our online Mental Health Champion Foundation programme for UK teachers and school staff. And the programme aims to enhance professionals' understanding of children's mental health and to introduce approaches that foster positive well-being in schools and community. As COVID made face-to-face delivery very difficult, we moved the training for teachers online, and the impact in terms of reach has been incredible. So as you can see from the slide, last year over 54,000 teachers and other professionals have accessed the program, and feedback has been extremely positive. So with 91% of teachers feeling that the course had increased their capacity to lead a positive approach to mental well-being and mental health. Next slide, please. So we know that positive parenting has a major impact on a child's life chances, and partnership with parents and families are crucial for supporting children with their mental health and creating mentally healthy school communities. And our parents' work strategy has evolved during the years, and we've learned from outcome data and research that conduct issues are less likely to respond to counselling, and that working with parents to develop their parenting skills is a much more effective approach to improving outcomes for children with conduct difficulties. So the demand for support for parents and carers is significant and has increased post-pandemic as expected. So to meet this demand, Place to Be has developed a suite of universal and targeted interventions to support parents and families, most recently focusing on utilising a digital approach. So we now have a team of family practitioners so that each Place to Be partner schools has access to parenting support as part of the standard offer. Our targeted offer includes PIPT, which stands for Personalised Individual Parent Training, which is a parent training intervention developed by the Conduct Adoption Fostering team from South London Moseley Foundation Trust. And PIPT is a dyadic intervention, so parent-child intervention for children with conduct, emotion and behavioural difficulties. It works by coaching parents on how to interact more positively and to parent more effectively. So this is what we offer in our partner schools. Our universal offer includes an online parenting course, which we've just launched, and a website called Parenting Smart. I'm going to put the link in the chat in a minute. We piloted the site in partner schools last year, and we've now launched it publicly. So do use it and share it with parents and carers that you work with. In essence, Parenting Smart is a site for parents and carers of 14 to 11 years old that offers practical advice on supporting children and managing behaviour. So really need that this time as we support post-pandemic recovery. So interestingly, Place to Be carried out a national survey of parents in September last year to learn more about the impact of the pandemic. And we found out that 1 in 5 parents, 1 in 5, thinks that their child's behaviour is worse now than before the pandemic. So parenting support is more needed than ever. And the focus for us in developing Parenting Smart was very much on early intervention and building capacity. So empowering parents with accessible, practical advice on common parenting challenges, from dealing with meltdowns and tantrums to bullying, to sleeping difficulties, to encouraging self-confidence. And the site was created in consultation with parents from our school communities, and it is used by our clinicians, by our school-based staff, during consultation meetings with parents where parenting advice is needed, and also used by our family practitioners who lead coffee mornings and community sessions for parents on specific topics, so starting schools, anxiety, managing transitions, and so on. There are 43 articles at the moment on the site, and we'll be adding new modules regularly. The content is written in a very simple, non-shaming language, and the principles underpinning the material are aligned with the Place to Be therapeutic approach. So there is a strong focus on attachment theory, parental self-awareness, and co-regulation. And we've also included elements from PIPT, our personalized individual parent training, our targeted intervention around behavior management. So the key idea being that behavior is a communication, and the parents can be helped to take a step back and understand their child's behavior before responding in a more empathic and effective way. So these are just some of the new initiatives that Place to Be has introduced over the last year. So in summary, the last couple of years have seen a huge amount of growth and development for Place to Be as an organisation, specifically around the breadth of our offer and the use of digital interventions to maximise our reach and impact. So the ability to evolve our service offer in response to users' needs will continue to be key to ensuring we offer the most effective support to the communities that we serve. Thank you so much. Shamat, I'm going to hand over to Gina. Very impressed that I managed to finish a minute early. You can see our contact details. I'll pop a link in the chat to the website to Parenting Smart.
Thank you very, very much, Cecilia and Jacqueline. That's incredibly helpful. And yeah, we look forward to having the link in the chat. Thank you. Okay, 2 more presentations before we have a little break, guys. So the next one is from Represent, and we've got a case study from Deptford Green School, and I believe we've got colleagues Emily and Shane and a student mental health ambassador. So over to you. Thank you.
Thanks, Sheena. So I'm Shane Carey. I'm the CEO of Represent, and we work with young people to help them recognise themselves and represent themselves better in the world. We've got a radio station that covers London, and all the content is created by the young people. So we've been delivering mental health support in schools since 2017. Next slide, please. Yeah, so following the first lockdown, where we prior to that we were delivering it in assemblies, we adapted the programme from an assembly show to an interactive television show beamed directly into the classrooms. The show's co-created with our young presenters and pupils, and the idea is it helps young people to become conscious of their own mental health, stress and anxiety, how to manage it, and then where to go to get support. So because we changed it from a physical show to a TV show, we were able to scale it quite quickly. And we went from working with 4,000 pupils a year to 28,000 in the first 6 months, which was great. Off the back of that, we won the HSJ Health Services Journal Mental Health Innovation of the Year. And that was in partnership with Healthy London Partnership and the University of Sheffield, who do our clinical oversight, which was brilliant to get the award. Can we go to the next slide, please, and play the video? It's just a little clip to show you. I think the one thing we always were pushing for is the conversation of mental health in every single school. We want to make sure every single kid has a chance to talk about it because it's important. Represent. On the level.
After On the Level, we appointed 25 mental health ambassadors from each year group.
We can now embed it in our curriculum because everybody feels more confident and comfortable. So it is definitely something that will have a longer lasting impact as well.
So can you grab your phones, go onto the Slido event and tell us how you're doing? Which level of stress do you think you are right now on the dial?
Some of you may be quite chilled and in the green, and some of you may feel like you're privately dealing with being in the orange and the red. That's a tough amount of stress to deal with. We hear you.
The year 9 and 10 mental health ambassadors planned and delivered assembly to year 7 and 8.
We've also got like little posters around the school talking about mental health ambassadors and the stress dials. The show did open up the conversation because some people, if they couldn't really speak about their emotions or whatever, they could at least say what colour and the stress dial they were. Stress dial.
If you'd like to find out more, then remember the resources pack has extra videos, games, and information. Represent. On the level.
Shane, you're on mute. Shane, you're mute.
Oh, sorry about that. Okay, so an unexpected outcome, as you can see from the video, was schools actually taking it on board and changing the culture within the school. So the package, very quickly, we baseline survey the young people at the very start to find out where they are in terms of their mental health and well-being. We create a resource pack which goes to teachers and parents, guardians, to help them continue supporting. And then we follow up 7 to 8 weeks later with a review show. And during that, we do surveys and compare against baseline. And once we've done that, we go back to the schools, we do focus groups and find out what young people need. And then we co-create it, make a new show, and then go back out. So I've got, oh, sorry, next slide. The impact of this, and it's just been published by the University of Sheffield, was great. The standout stat was, out of all the people we worked with, over 10% went on to have one or more interventions with COOF, which is fantastic and more than we expected. So I'm going to stop talking and I'm going to introduce the stars of the show. It's Emily and Precious from Deptford Green.
Thank you, Shane. Hello, everyone. So as Shane said, we at Deptford Green, our whole school approach to mental health and wellbeing is, you know, I would say has been a strength over time. But one of the things that Represent really jumped out to me in terms of getting them into our school was just the different approach. So they were young, they were from lots of different ethnic backgrounds, they were DJs, and I was hoping, and it's exactly what it did, that it would reach out to a different cohort of students in our school, because lots of the students who were accessing the counselling services were white middle class students. We wanted to reach out to a different group of students to say that mental health, it's okay to struggle with your mental health no matter where you're from. So that was why we got representing, and it really made a big difference to our school community. So they taught our students lots of different strategies which are now embedded across the school, and they also gave lots of apps and support services which were really helpful. And then finally, and that's why Precious is here, the students as a result of Represent said we want to talk about mental health all the time. So we want mental health ambassadors across the whole school to support as student leaders, and so that's been a really big progression in our school. So I'm going to hand over to Precious, who can talk a little bit more about the mental health ambassador role.
Hi. So in each year group, we have a certain amount of ambassadors.
Sorry, Precious, we can't see you. Could you move more towards the camera? Oh, that's better. Yeah, lovely.
In each year group, we have a certain amount of ambassadors who have been trained, and they are aware of what needs to be helped and what needs to be said for someone that needs help. We also have the stress styles that we have gone to each year group, explained to them. We have amber, green, yellow, and red. So most of the time, whenever we go to different year groups, we would ask them where they are right now and how they could improve from where they are at the moment. We also, if they needed someone to speak to, they could come to anyone that they recognize as an ambassador. And the way they're recognized, they have a badge on and they tend to be in the assembly at the front. Thank you.
That's brilliant. Thank you, Emily. Thank you, Precious. And just to round up then, because that was so brilliant, Deptford Green was so brilliant, we've built that into the offer now. So we're going to be providing mental health ambassador training and advocacy alongside what we're doing. So finally, we're working to try and get this in every single school in London. And we're targeting commissioners and clinical commissioning groups and local authorities. So my colleague Nikki, who's here on the call, will be about for the Q&A at the end. But get in touch if we can help, if you can help us get it into your area. And thanks for your time.
Thank you very, very much, Shane, Emily and Precious. Precious, there's a lot of love on the chat for you. Really, really lovely presentation, and lovely to hear about the mental health ambassador work. So thanks, our final presentation of this section will be from Waltham Forest, and that is going to be from Gemma and Kirsty. So over to you. Thank you.
Thank you. I'm not sure how to follow that one, but we'll try our best. So good morning, everyone. My name's Gemma Fitzgerald, and I'm the clinical lead for the mental health support team in Waltham Forest. And I'll introduce my colleague, Kirsty. Do you want to say hi, Kirsty?
Hi, I'm Kirsty, and I'm the clinical lead for the primary care team in Waltham Forest CAMS.
We're going to talk to you today about our school-based mental health services and how we've tried to integrate them into the existing landscape within Waltham Forest. Could I have the next page, please, or next slide? So Waltham Forest is in North East London. It's one of the most diverse areas, and there are over 45,000 pupils in Waltham Forest, and we have just over 70 schools, and they're including alternative provisions. Next slide, please. Next slide. So several years ago, there was a call to action and a need to change our approach to delivering mental health to children, young people and their families, moving away from the one building in the community, similar to the picture shown. This is what young people said that they used to perceive CAMS as. Children, young people said that we need to make sure services and support are inviting, welcoming and easy to access. We had also lots of discussions about the lengthy waiting times. Next slide, please. So Waltham Forest looked to the Thrive model to help structure and facilitate change. We work collaboratively with children, young people, parents, carers and education to identify areas of mental health need. What was clear was the need for school-based mental health services, such as our primary care team and the mental health support team. Participation has been a key pathway of support within the PCT and the MHST that we've continued to invest in and develop. This also runs throughout all of the services that we have within Waltham Forest. Next slide, please. So this is a timeline of the development of the school-based mental health services. So the primary care team were established in Waltham Forest in September 2019. When the pandemic hit, the PCT worked closely with the schools to build on the mental health support that they were providing students, families and school staff with. They continue to adapt their delivery to make sure that they were meeting the mental health needs of everyone. In September 2020, we started to recruit to our first wave of mental health support teams. The MHST were then launched in January 21. And from March 21, the MHST and PCT offered a partnership approach to schools in the borough. This has continued to develop, working closely with schools, specialist CAMS, and other health services. We've found that connection is key to delivering effective school-based mental health services. With this in mind, we worked with children, young people, education, public health, other health organisations and third sectors to create our very first mental health network in the borough. This was a space for schools to share best practice, resources and also access a range of different CPD training. And at the network, we had representation from over 30 schools. So for our first one, we were really chuffed with it. Next slide, please. So when looking at mental health in schools, it's really important to look at the fantastic work that's already being delivered by schools. So children and young people regularly talk to us about the positive support that they've received from pastoral staff and other school staff. In Waltham Forest, we also have a range of other great services and support that children, young people, parents, carers and school staff can access to promote their mental health and well-being. So I don't have time to go through all of them, but I've just sort of made note of them on this slide. And then what I can do is I can send out more information after the presentation. So what I'll do now is I'll hand over to Kirsty and she can talk to you about the primary care team.
Hi everyone. So can I have the next slide, please? And the next one. Okay, so the primary care team, like Gemma said, we kind of were originated first, and it was because Waltham Forest, we lost a lot of our intermediate services, so on old money tier 2 services. So we still had specialist CAMS, but there was nothing in the borough, or there's very little, it's limited in the borough for lower level need. So we established a primary care team, and what we do is we support children and young people with mild to moderate mental health difficulties. We're part of the wider CAMS, so we have a very easy kind of relationship with them, and we're able to kind of transfer people into specialist CAMS if we feel there's a need, but the work we do is delivered in schools currently. We're also in some GP practices. The idea from the very beginning was that we would actually be based in the community. The easiest place to start, we felt, is where we could catch children. That would be obviously in schools, but the thought is that we now want to develop further into the community. We're working with things like the YMCA. We're looking at alternative different bases, libraries and spaces where we can actually hold some kind of workshops, hold a space where we can meet young people. We also cover, the PCT also cover all the alternative education provisions. And all our interventions and our support are evidence-based and they're needs-led by the young people. Next slide, please. Referrals that we get, they come directly from schools, GPs, specialist CAMS and also MHST. So we all work very closely together. So we have this as smooth journey as we can. A young person may be, if for example, referred into MHST, but it's felt that the needs are a little higher, so they could come into the PCT. If we feel that it needs to go higher again, and then we'll go through into specialist CAMS. So it's about making as smooth a journey as possible. We also deliver some parent work, direct work with parents. We do some evidence-based work with them. Coffee mornings, that obviously had to go by the by when we hit with the pandemic, so we're starting to build that up again now. We also follow the whole school approach and are doing some joint work with the MHST around how we can actually deliver these interventions in schools. Primary school work, it happens primarily with the parents or the carers. Small group interventions, we do sessions for teaching staff as well, where education staff can consult with us if they feel that they have a need. It could be specifically about a young person or a group of young people in school, or it can just be for more general thinking about mental health in schools. Next slide, please. Same goes for secondary school. Pretty much the package is the same for primary, other than the work is a little different, that we do a lot more one-to-one sessions with our young people that are of a secondary school age. Next slide, please. Oh, back to Gemma.
Brilliant. Thank you, Kirsty. So the mental health support teams were part of a national programme, as some of you already know. So working with children and young people who are experiencing mild to moderate mental health difficulties. Next slide, please. So we receive referral. Oh, next slide, please. I'll skip over that one. Brilliant, thank you. So we receive referrals directly from schools via the school's mental health leads, similar to what Kirsty has said about the primary care team in terms of package. So we offer one-to-one support to children and young people, to parents and carers dependent on the age of the child. We deliver evidence-based resources and interventions. We offer small therapeutic groups. We also offer whole school approach sessions, interventions and support, and also consultation sessions as well. We also offer CPD training to school staff dependent on the areas of the needs. And also another strand of support for the mental health support team is around what we offer to parents. Next slide, please. And secondary is very similar as well to what I've already discussed. So if I go to the next page, please. And the next one. So participation and co-production is so important to us, and making sure that we just don't listen to children, young people and families, but we also take action. And this is something really important to us and to the young people that we work with. So we do this in a variety of ways within Waltham Forest, and some can be seen on the screen. So we have children and young people's forums, we have social media accounts, we have student wellbeing champions within schools, parent forums. We're creating some podcasts, and we regularly ask for feedback. We have a dedicated team of staff who work with our children and young people who form our local participation team within Waltham Forest CAMS. They meet on a fortnightly basis and have been working on a number of projects. Next slide, please. So I've taken some screenshots to highlight some of the projects. So we have a YouTube account where we have a number of different videos that the young people have created, talking about what is mental health and the 5 ways to wellbeing. We've also done some videos for Children's Mental Health Week. We have an Instagram account that our participation team regularly upload content on. We have a condition series where young people talk to the participation workers about different disorders and conditions and upload information that's helpful to young people. We've also been creating some stop motion animation and, as I said, some podcasts. Next slide, please. Next slide. Next slide, please. Thank you. So feedback's really, really important to us. It's not just about quality assurance, but it's about quality improvement. So we always work with students, with teachers, with designated safeguarding leads, anyone that we're working with, just to obtain feedback on the resources and the interventions we've been providing. And if I go to the next page, please, and the one after this. So I just want to finish on this one, just to say that we just want to highlight the importance of services working together. And the reason why I wanted to end on this slide is that it looks at all of the different services that we're working really hard together with in Waltham Forest, but just making sure that we don't lose sight of what we're doing, and we always make sure that we put children and young people and their families at the centre of everything that we do. Thank you.
Gemma and Kirsty, thank you very, very much. Really, really helpful and interesting presentation. We're going to break now for 10 minutes. So if we can come back at 54.
So I'm going to chair for this last session, after which there will be another short question and answer session at the end. And as we are keeping track of questions as they come in, but just a reminder to presenters, if you are able to go back into the chat after you've made your presentation and pick up any questions, or certainly specific questions related to your presentation, that would be really helpful. Okay, so I'm going to Kirsty, we're going to return to Kirsty, who's going to introduce this next session, which is specifically around the mental health in schools teams. And so I'll pass over to you, Kirsty. So thanks very much.
Thank you. Well, I'll just be very brief, but you've already heard from me, but I'm thrilled there's a section celebrating the mental health support team work. It's something that was only rolled out a handful of years ago, and when the world looked like a very different place. So the need for them was already there, but it's only become more accentuated. And I think that colleagues across health and education have done an incredible job carving out a brand new programme, but utilising the services that already existed in a landscape that was changing, and also where every single school they worked in and every single community they've worked in, it was a very different starting point and a very different picture. So I think it's some really impressive work that's gone on over the last few years. So without further ado, I think I'll just hand over to let's celebrate the work of the mental health support teams. So I think, I'm not sure who's speaking first. It looks like it might be the educational psychologist perspective. There we are. What a good place to start. Over to you.
Morning, everyone. Just waiting for Katie to join us.
Hopefully it's appeared on the screen. Hi, everybody. So I'll just introduce myself briefly, and then I'll let Michael introduce himself. So I'm Katie Lydiot. I'm an educational psychologist, and I'm also a Joint Service Development Manager for Lewisham MHST. Soon to move into a new role, joined again as CAMS Schools and Wellbeing General Manager for South London and Maudsley. And I also work on the King's College MHST Supervisors course. Michael, do you want to introduce yourself?
Yeah, good morning, just everyone. Yeah, I'm Michael, and I'm an educational psychologist as well, and a family therapist, and I'm co-lead on the EMHP Supervisors course at KCL.
Next slide, please. So we're just going to talk really briefly about educational psychologists in MHST and the contribution that we think they can have to this really important programme. So first of all, we're going to explain the role of the EP, and then we're going to explore and celebrate some of the contributions that we've come across in our work, and then consider some of the opportunities and the challenges moving forward. Next slide, please. Okay, so what is an educational psychologist? There is a lot of misunderstanding out there, I think, about what our role is. So really, we work in partnership with children and young people, families, schools and communities, whereas there is any concern that could impact on access to learning. So we really work at a systemic level, including whole school projects, through to working individually with children and young people who may be experiencing difficulties in a wide range of areas. And within this, we include social and emotional mental health. So EPs may work in MHSTs in a variety of ways. You may have come across them on your journeys. So some of us work directly in mental health support teams. Others we may partner with through our work in local authorities. And then within MHSTs, they may take on a variety of roles. So I suppose in essence, we are applied psychologists who work in the context of schools and education settings. Next slide, please.
Sorry, if you can press that, great, thank you. Yeah, this slide's going to be slightly problematic. If you keep going, thank you. Perhaps press it one more time. Keep going, please. I think there's a couple more clicks to go. Okay, so this is our attempt to represent the rich and complex context that we feel you enter when you work with schools to support children and young people's well-being and mental health. So you've got the intersection between the school system and the family system, and the child and young person transitioning between the two on a daily basis. You've got the intersection between mental health and emotional well-being, and interventions at the universal, targeted and specialist, fitting into that structure, if you like. and then this all sits within the community and then the local authority. There's something about acknowledging the legislative framework that frames this context. I think one of the things I guess we really invite is to understand the child and young person's presentation within those dual contexts of school and family, and then working in partnership, and people have talked about this a bit already, with representatives from those systems, so representatives from school and family, and also other professional groups. So you're really trying to build a partnership through the work. And certainly some of the work we're doing with supervisors and wider MHSTs is inviting them to think about the positions they may have or occupy within this context. You know, we've all been to school, some of us will be parents, teachers, counsellors, and really to think about how those positions might inform the work that we undertake with schools. Thank you. Next slide. In terms of how we might work, I suppose there's something around, sorry, bear with me a second, just got a slight issue with the slides. That's better, thank you. So this is a model from the EP world, and I guess it's something we're inviting MHSTs to think about. There's something about the development of it being in sync with the plan, do, review cycle that schools might well be using, so joining with school systems. The real emphasis on contracting with school and family representatives and others in the professional network. So again, really thinking about partnership and meaningful engagement through the process. And I think this model also privileges evidence-based practice, but also practice-based evidence. So there's a component of gathering information on what you've done that informs what you subsequently do. So really thinking about ecological validity and accessibility. Next slide, please.
Oh, sorry, just go back one for me.
Sorry, Katie.
That's all right. I was just going to have a, oh, we've gone forward. If we can, that's it, perfect, thank you. I was just going to talk about this in terms of a real life example, because this is a model that we use quite extensively within Lewisham MHST. One of the ways that we use it is in planning our bespoke whole school activities. So we have kind of an off the peg offer of whole school approach activities, and then we have ones that we develop with schools based on their own needs. So in terms of the contracting, establishing roles and expectations, some of that happens through use of a mapping tool and audit, where we establish what we call a wellbeing team with the school. Our aim here and our hope is that that will involve internal partners, so school staff and other people they're working with like Place to Be, as well as external services. It may be that a theme comes up through that, or something just happens in school where the school think, actually, we need to approach this in a way to think about how we support children and young people. So then we would go on to working with the school to really think and understand what the hopes are for change, ideally bringing in children and young people into this, maybe parents as relevant. Think about what's tried already, current situation, capacity, what could work in a school situation. And this is part of our joint problem analysis, where we develop a real shared understanding of the situation and ideas for change. That is then brought back to our internal MHST whole school approach committee, and our aspiration is we will have teacher representatives on that as well, where we think, actually, how can we develop real and sustainable change through a whole school approach activity? And then we go back to the school, we really think about how we put that into practice and how we evaluate and monitor what is happening. So an example at the moment is around exam stress. So we originally did exam stress assemblies, but now we've developed that to really go into tutor groups to look at how we practice some of the strategies that we are talking about with the children and young people, how we measure change, so confidence ratings before they begin, during, and then 2 weeks after, so we can see if that change has actually led to any difference. But then also within that, how we are working with staff, how we are working with parents to make sure that all of that knowledge is shared, the same language and examples, and opportunities to reinforce and model those, model that learning in the school context and the home context. Okay, next slide, please.
So very briefly, I guess there are examples of EPs contributing at all these levels. So in terms of school readiness, using the data and intelligence that the educational psychology services have to inform how MHSTs join with schools. There's something about building on existing relationships with regard contracting and partnership working. We've talked a bit about that already. There's something about utilising EP knowledge and understanding of assessment and evidence-based interventions, but also practice-based evidence. There's something around how EPs can support existing systems and structures being developed and built on as MHSTs join. And then there's finally, I suppose, EP expertise and experience of whole school approaches, which again, I think, Katie, you're going to say a little bit more about.
Yeah, I was thinking actually that what I might talk about is a couple of the different roles of EPs. So this felt a bit weird talking about it actually, but as I've said already, I'm an EP and I job share the role of service development manager currently in Lewisham MHST, and I reached out to a couple of my colleagues for them to reflect on maybe what I brought that was different to the team rather than me coming up with it myself. And some of the ideas were around the understanding of the complexity of the schools, the experience in practice-based evidence as well as research-based evidence, just taking a different approach and challenging some of the more traditional models towards working with mental health. And I think as well, I will say that I have learned so much from the team and people coming from different professions, different knowledge, skills and understanding and ways of working, particularly with schools. And then something around really thinking about the power of the voice of the young person and parents and carers as well. So those have come from other people, not from me. And then I think from my perspective, there's been some really exciting projects that have actually happened between the EP team and our team. For example, some work at the moment around emotional-based school non-attendance, which I think is just so much stronger because we're working together, taking into account a different professional mix and experience and training. Next slide, please.
And actually, could we, in terms of interdisciplinary working, can we have the next slide, please, as well? So this is something we talk about, and Kirsty referenced it earlier, the idea that there's one of these, it may look different, the titles may be different around each school, and there's something about how the MHST can join with existing services to really think about work at universal, targeted and specialist levels. These people may not always attend a meeting, they may do, but there's something about how to develop the working and the connections and the partnership with schools and with other colleagues who are already working in this field that feels really important.
If you can go back, please. And I think just there's a couple of opportunities and challenges here. I know we're short on time, but I think some really important ones around how are we ensuring nationally for mental health support teams that the whole school approach retains its position as a key focus. And then another really important one for me around recruitment and sustainable employment options for EPs in MHSTs. There is an EP shortage, there are differences in pay scales, there are things like secondments happening, but they're often kind of short term for only 2 years or so. So lots of things to think about to strengthen this work together. Thank you.
Thank you.
Ian, are you with us? Oh, I'm not sure where Ian's gone, so I'll introduce the next presentation. Annika, thank you very, very much. You're going to talk to us a little bit about mental health in schools teams in South West London. So over to you. Thank you.
Thank you. Shall we move on to the next, onto the first slide? Thank you. So I'm just going to start with a little bit of context. So my name's Annika Clark and I'm a clinical psychologist, but I'm also the clinical lead for mental health support teams and CWP teams for our trust in South West London. And our trust is South West London St George's Mental Health Trust, and it's one of 4 providers with 16 mental health support teams across South West London. And we run 8 of those mental health support teams in Merton, Sutton and Wandsworth. Okay, the next slide, please. So from the very first 3 Trailblazer teams, we've used the same model of working. Each team works with a set cluster of schools, and we have a cluster lead who's a head teacher who chairs a half-termly cluster meeting attended by representatives from each of the cluster schools. And cluster meetings are also attended by borough education leads, commissioners and other relevant stakeholders. The aim of the meetings is to maintain a whole cluster focus across all the schools on the agreed action plan for the year. And that involves sharing of ideas and resources across schools, and that's part of the whole school approach. From Wave 2 onwards, South West London has introduced a more specialist focus for new clusters and new mental health support teams, depending on the local health inequalities and the local need. And this is on top of the continuing more general early intervention and prevention remit that all of the mental health support teams have. So I'm going to give you a quick whistle-stop tour into 2 of these teams that our trust runs. And can we have the next slide, please? So the first one is one of our Wandsworth teams in Battersea, and the mental health support team there consists of a child and adolescent psychotherapist, a clinical psychologist, an occupational therapist, a drama therapist, the 4 EMHPs and our admin support. And they work across 15 primary schools, 3 secondary schools. It's a Wave 2 team, so it's set up in 2020. And they have 2 particular focal points. One is about introducing a trauma-informed approach, and the other one is about increasing access to interventions for BAME students. I'm going to focus on the trauma focus, partly because it feels most relevant for a very short introduction to it following the pandemic. So next slide, please. So I think there we go. It's really important to note that a trauma-informed approach isn't a standalone intervention. It's not a technique or a checklist that can be delivered in isolation. We use it more as a formulation to guide systems. It needs, or it relies on having an awareness, sensitivity, and often change at a cultural level across an organisation. So there are 4 key assumptions that we work with to underline our trauma-informed approach, and they're up on the screen. And the realise bit is just understanding the scope of the problem. So pre-pandemic, it was understood that around 1 in 4 children in the classroom would have been either exposed to or experienced a traumatic event that might impact on their learning or behaviour. It may be that that's higher now. And the recognising aspect is recognising that trauma presents in a huge variety of ways, particularly at schools. And schools are, of course, learning establishments, and their key goals are to educate children and young people. And so as part of that, it's really important that children behave well and don't disrupt learning for other children too. But it's quite easy then for schools to get drawn to focusing on poor behaviour, managing poor behaviour, talking about poor choices. And I think part of the recognition around a trauma-informed approach is trying to move away from asking about what's wrong with you to thinking more about what's happened to you. So understanding that behaviour is often just the bit that you can see on top of an underlying need. Then moving on to thinking about the respond and the resisting re-traumatisation part. It's really about taking a systemic view to identifying, assessing and treating traumatic stress. So a key part of it that we try and work on with schools is just to create a safe environment at school through safe, positive relationships and looking at the underlying need behind the behaviour. So, I mean, what we know is that children who have experienced trauma often present as either hyper-aroused or perhaps under-aroused and almost numb at the two extremes, with of course a whole range in the middle. And helping to regulate those nervous system responses are really key. Also key is helping to build connected relationships throughout school and supporting the development of some kind of coherent narrative around what children have experienced. We think a lot about building social and emotional resiliency skills and helping schools really practice power with strategies. What we know about young people in particular who've experienced trauma is that quite often there's a real feeling of a loss of power and control, and there are some quite strong disciplinary practices that can really build into flooding that feeling back and getting a real pushback response. So thinking about how you can work with and encouraging a system of respect and sort of calm responses. Can we move on to the next slide, please? So I'm really not going to spend very long with this. I've picked it up just to try and think about this systemic idea of working with trauma. And there are some key trauma-informed principles. I've touched on some of them, really to implement a feeling of safety and trust in schools, really collaborating, looking at building collaborative partnerships with parents as well. Trying to build a sense of empowerment and having a real cultural sensitivity around where children are from and what they may have experienced. So I'm just going to leave that for you to look at. Move on to the next slide, please. So we've got an occupational therapist in this team, and she's been really key to helping us build what we call a whole school sensory approach. And so she's looked at helping schools understand sensory strategies, classroom adaptations, to help with that hyper arousal or under arousal that some children may come into school with, to help them be ready to learn. There's also a focus on function and skills building, looking through a sensory and an attachment lens, and helping students and staff to help to regulate arousal levels. And another key part of what she does is help implement some practical and predictable routines and activities in schools. There's very good feedback from it, actually. And then the other clinical work I'm not able to really have time to go into today, but we've got a good multidisciplinary team around them. Can we move on to the next slide, please? So the other team that I'm just going to give you a very brief overview of is we have a mental health support team that only works with FE colleges. They work with 6 very large FE colleges. Thank you. And we've got 1 in each borough, excuse me, of the southwest London boroughs. So they cover a huge geographical area. And in that multidisciplinary team, we've got an educational psychologist, a clinical psychologist, a social worker who's also a CBT therapist, a drama therapist, and of course the MHSTs. And the specialist focus in this team is around transition to adulthood. Next slide, please. So there are some key issues that are very different for working colleges and schools. Of course, students are all 16 plus. We only work with 16 to 18-year-olds, but colleges have a very large adult population. They're huge institutions. They have very close timetables. They have they're about throughput. They often work on a business model. They only have students for 2 years. So they have a very different feel and culture to them. And it's been much harder to establish self-referral pathways. Next slide, please. So what I just wanted to give you a sense of is that the whole college approach that we've been putting in place in the colleges has had a very multi-layered approach, as you would have with all of them. So the topics tend to be slightly different in terms of the wide approach we use. So in colleges, we have run workshops with students around abusive relationships, being motivated, having some self-awareness around mental health problems. It's at a much older end, and for staff, we have really focused on trying to take the approach away from just specialist mental health and having a programme called Every Conversation Matters with tutors. And I am finishing. One last slide. This is just to leave you with some of the resources that we use. Can we move the next slide on? Thanks. We have a YouTube channel where we've developed a lot of videos. So if you're interested, there's a whole wide range there and there'll be more information. Thank you.
Thank you very, very much, Annika. Really helpful presentation and so much lovely work going on. Apologies from Ian, he's had some connectivity issues, so he'll try and rejoin us as soon as he can. So we're going to hand over now to Isla and Christina, who's going to talk to us about some celebrating of diversity. So over to you, and thank you very much.
Thank you so much. Good afternoon to everybody. It's such a pleasure to be here. I'm actually so honored, and it's so exciting the fact that we're taking time to celebrate. I think that is something so powerful in itself. But my name is Christina. I'm a mental health practitioner, and we also have Isla, our clinical lead. So Isla, you can just wave to the beautiful people here today. Okay. Yeah, Isla is muted. Thank you so much. So we can move to the next slide. And the next one. Today I'll be talking about celebrating diversity. So as I mentioned, I'm a mental health practitioner from Mind in Westminster, Brent and Wandsworth. And we are a team of mental health practitioners, clinical supervisors, our admin as well, and our assistant psychologist. And we deliver one-to-one sessions for young people and their families around anxiety, low mood, challenging behavior. So quite a big piece of work. And we cover 33 schools across Westminster. And I'm just so proud of the team. I'm proud of what we do, and I'm very passionate about what we do. I think mental health is something so important, and we also deliver workshops for schools, for staff, for young people and for parents. I love public speaking, so that is something that I love to do. We can move to the next slide. So just to give you an overview really of the journey for the team around diversity, we started in 2019 when MHPs were trained and supervisors were recruited as well. 2020, we qualified, and really it was between 2020 and 2021 that the themes of diversity really emerged, particularly after the injustice that George Floyd faced. So the theme of diversity was really at the back of our mind. And it wasn't until the early 2021 that a colleague started completing an audit for our service based on the BACBP positive practice audit to really understand what is it that we're doing well and what is it that we can improve. And end of 2021, I'm just so proud to say that we actually started a diversity project which aims to train ourselves so that we can be more culturally competent. Moving on to the next slide. So the purpose, as I mentioned, we just want to make sure that as a team, we're able to serve a diverse population. That is our aim. That is our purpose and vision. So we just want to block out time so that we can actually reflect on what can we do differently and what are we already doing well, so that we can also make sure that we are celebrating the good work that we're doing. On to the next one. Yeah, next slide, please. Fantastic. So every single thing that we do is a work in progress. It's so important for me to say that. And I can say that in terms of the audit, what I can definitely say that we're doing a fantastic job in improving access for diverse population. So we are asking a lot more questions to understand the ethnicity of our service users. So we're not just assuming, particularly when they say other, we're really understanding what is their heritage. And also we're comparing referral statistic to the demographic of each individual school, so that we're actually understanding, are we actually serving the population of the school? And if that is not the case, then we can link in with mental health leads, just so that we can have a conversation to understand how can we improve that access. We're using SPSS to compare outcomes for different people groups, and we are also trying to understand the main languages spoken in each school, so that we can link in with interpreters as well, so that everyone can feel like they can communicate in the language that they feel most comfortable with. And being a person that speaks more than one language, I can see how that is very important. And also we're linking in with other teams that are creating leaflets in community languages, so that we can also do the same. Moving on to the next one. We're doing very well at adapting therapy. We've received training around diversity, and that's been so important in helping us to understand matters of diversity, understanding how mental health is approached and understood in different cultures. So that is something that I'm very proud of. Next slide. Improving engagement with service users and communities. This is definitely something that's been particularly difficult. We recognize the difficulties, but we're trying to use forums to really ask explicit questions to understand how we can bridge this gap. Next one. And this is something that I remember Alex was talking about, and different people have touched on this to really reflect how difficult it is recruiting MHPs. Also, there seems to be a lack of diversity in the field of psychology, which seems to be reflected in the senior management group. So those are some of the things that we're trying to bear in mind. Next slide. Let me come to the success story. And this is something that is so important for me to share. So proud. A colleague of mine has completed a piece of work with a young person from Asian heritage who is 18. And really the focus was around low mood. But what the colleague did that was so important was to bear in mind the cultural heritage of the young person, the fact that he was indirectly affected by the gang culture, and also recognizing the fact that he was stopped and searched a number of times, recognizing that he has a lot of responsibilities at home. So let's move on and let's see how we adapted the therapy. So space was given to the young person to actually explore how does it feel? The fact that you were stop and search, how does that feel? Tell me a little bit more about your ethnicity. Tell me a little bit more about your culture. So those things were explored with the young person so that he was able to link his experience to his values. And then together, the colleague and the young person thought about what is it that we can include in your therapy, in your treatment to help you and to support you, so that we can really understand what activities perhaps you can do in line with what you value. Next one. So I'm proud to say that the depression scores definitely went down. The young person started engaging with much more activities that he stopped doing. And overall, it just had a much more positive outlook overall. So that is a success story. Next one. Statistics. Let's look at stats as well. Next one. I'm proud to say that as a team, we served a very diverse population. So compared to the Westminster population, the service users that we deliver sessions to are quite mixed. So white population, there's a real good mix. And that is something that I'm proud of, because it means that we're serving a diverse population. Next one. And also, I'm proud to say that in as much as what we find is that non-white service users start with higher scores of anxiety, depression, one thing that we also say is that they end with lower scores compared to the white population. And I think this is so encouraging, because oftentimes, thank you so much, oftentimes what we see is that non-white service users don't quite access the therapy. So the fact that they end with lower scores, that's very encouraging. Next one. And also what we know is that the service users that we work with, they live in quite deprived populations. And that is something that we keep in mind, really, and something that we had in mind also during COVID, because that, of course, would affect the inability perhaps to access remote sessions. This is really something that we were mindful of. Next slide. Yes, I've covered this as well, so we can move on to the next one. And really just to conclude, I think you can see in my voice that I'm just so passionate about what I do. I'm so proud of the team. You know, we received the training around diversity, and I know that this wasn't just a tick box exercise that we did, but it was something that we wanted. It's something that we went to search for, and we did it. So this is just to encourage everybody, all the teams, to receive, you know, the training that you need, and then continue to build on that so that you can continue to grow. So yes, as I mentioned, we've greatly benefited from the training. I'm just looking forward to the team to continue to expand, and it was just a pleasure being here. So thank you so much, everyone.
Thank you so much, Christina. Sorry, I'm back. I lost the connection for a bit, but it was brilliant to catch your presentation. And yes, your passion really does come across. But really important work. So thank you for that. And our last presentation, but very much not our least, is from it's Mind, and I think there's 3 of you. I'm not sure. Nana, are you starting?
Yeah.
And then, yeah, okay. And so I'll pass it with you, Nana, and look forward to your presentation. Thank you very much.
Thank you very much. And thank you very much, Christina, for bringing the energy up and showing your passion. Nice. It's nice to have that to follow on to keep us going. So hi everyone, I'm Nana from Hammersmith, Fulham, Ealing and Hounslow Mind, and I'm here with my colleagues. I'll let them introduce themselves quickly. Rajni and Natalie.
Hi, I'm Rajni. I'm the service manager for the MHSTs and the deputy head of CYP services.
I'm Natalie. I'm the wellbeing team manager and I lead on the trauma-informed services and inclusion.
So I'm going to just go through a quick presentation and hear from the voices of young people and our partners themselves. So our presentation is just simply called HFEH Mind Open, Together, Responsive, Independent, Unstoppable. It's just showing how we live and work through our values throughout our MHST and our school services. Can we go through the next slide, please? Thank you. The next slide. I won't go into detail about who Mind are. So as you know, Mind is a leading mental health charity, and we are one of 25 local Minds, and Brenton Wandsworth Mind, who was before us, are our neighbour in Mind. Shall we go to the next slide? So yeah, in terms of our values, what you'll hear throughout this presentation is about how we are open and we reach out to everyone who needs us. And that's in terms of our services, young children and young people's services. We ensure that we listen to young people's voices through our co-production group and adapt and develop projects and services to meet their needs. We also do a lot of campaigning work within the local community as well, and stronger together. So we're stronger in partnerships, and that hopefully will come out through our presentations about as they say, it takes a village to raise a child, and we really live that in terms of working with our partners and our parents and people within the community, and we listen, we act. And as a charity, we are independent and we speak out fearlessly to ensure that every child that needs that support and that we come into contact with, we will do whatever we can to ensure they get that support, if not by us, by our many brilliant partners that we work in partnership with that we can signpost to. And we're unstoppable, we'll never give up. And so I'm just going to go next slide, please. Going to hand you over to Rajni to talk about some of our services and go into details about the mental health support team.
Hi, thank you, Nana. So yes, we've been hearing a lot about the mental health support teams across different services. It's going to give you an outline of how it looks like in a voluntary sector and under HFEH Mind. So we do have the mental health support teams, and we are in North Westminster, Kensington, Chelsea and Hampstead Fulham as boroughs. So we have 30 schools in Kensington, Chelsea and North Westminster and 25 in Hampstead Fulham, and we cover 55 schools in total. So our staff team is made up of EMHPs, CWPs and PWPs, as well as clinicians or art therapists, clinical nurses, CBT therapists and psychotherapists as well. And the offer of support at the MHST is the one-to-one support for children and young people, parents and staff members. So all of our staff members have a whole school approach to mental health. We support the whole school community. So our EMHPs, PWPs and CWPs offer the whole school approach around staff support, as well as our whole school approach worker, who is a designated role to support around staff wellbeing and mental health, and does training sessions around staff to support students' mental health and parent mental health as well. Under that provision, we do offer workshops and group work as well, which is to parents, carers, as well as CYP and also our staff members in schools. We offer support to young people with mild to moderate mental health difficulties. And under youth services, we also have the Wellbeing Service, which Natalie is the manager of, and we offer support to young people aged 10 to 25. But in terms of our emotional wellbeing education hub, it is available for young people from 0 to 25. Natalie's going to give you some more insight into the inclusion projects as well. But apart from the MHSTs, we do have other offers within these services. So something that we are building into our service at the moment is our digital hub. So young people who may be accessing support through schools can also access one-to-one support through our digital offer, which is WISE, which has been developed this year. And also our parents can access the digital parenting programme, which is going to be rolled out this year as well. And that complements the MHST support and will be available to our communities and our boroughs that we serve as well. Over the lockdown period, we also developed My Mind TV, which is an online resource, a bit like a YouTube channel where there's lots of resources that complement the offers that we have in the MHST, but are available across the community as well. We do have our complex needs hub as well, where we support young people with moderate mental health needs as well, and offer brief interventions. And something that we're developing over the next year or so as well is our social prescribing hubs. And Anna had mentioned about our partnership working. So we do work quite closely with our local football clubs, and we're introducing other projects as well as time goes on. Nana, do you want to add anything further to the hubs before we move on?
Not really. You've covered most things. Shall we go on to the next slide?
Sure, I'll hand you over to Natalie. Oh yeah, in terms of our activities. So we began in 2019. So we began with the West London MHST, and then in September of that same year, we also have the Hampton Fulham MHST. So since we began in 2019, our reach has been to 7,759 young people. And you can see a lot of the reach has come through our actual groups and workshops. So that's parents, carers, staff members, as well as CYP as well. And we do have a lot of one-to-one support that we're building. Due to the lockdown period as well, we began to offer more blended approach. So we do offer face-to-face sessions in schools and also remotely. And we also developed a universal workshop programme that runs across the academic year. So parents and carers and staff members can have multiple opportunities to access support around psychoeducation and how to support children with their mental health as well. And we've had some really positive feedback about the one-to-one work and the workshops that we've done in the community. We do also have offered we developed a staff drop-in service, parent drop-in service as well over the lockdown period. We recognise, actually not being in schools, we do recognise that we need to be more available and accessible as well. So we are continuing to offer our drop-in service in all of our MHST schools. I'm just going to hand you over now to Natalie, who will give you more insight into some of the inclusion programme.
Thank you. Next slide, please. So I want to briefly take you over the Education Inclusion Programme, which supports education provisions to work with young people who are at risk of exclusion due to underlying mental health needs. So when looking at mental health and exclusions, our rationale is evidence-based on the fact that persistent disruptive behaviour continues to be the most common reason for young people to be excluded from school. So we developed a programme which delivers psychoeducational workshops to raise mental health awareness and how mental health can affect access to education, academic attainment and classroom behaviour. And this programme has proven to be very effective as we've seen a reduction in both school exclusions and suspensions. We've also seen an increase in referrals to the mental health support team from alternative provision students who had historically refused to engage with statutory services. We place an immense amount of importance on co-production and take a strengths-based approach to ensure that all our young people are able to identify and to celebrate their achievements by highlighting what is strong, simply then saying what is wrong. So to do this in a holistic and systemic way, we work with the entire school and the parents and carers to support the needs of the young people. Next slide, please. So a core function of the mental health support team is to apply a whole school approach to children and young people's mental health. We do this by the Wellbeing Ambassadors programme. We train staff in a trauma-informed approach, neurodiverse awareness and culturally sensitive practice to ensure that young people get the right support to stay in education and to support their mental health. The schools really value the assistance and expertise from our services, and in line with our values, next slide please, we would like to show you a video from our schools, organisations and the young people that we support. Thank you. Press play please.
A quick endorsement of the Hammersmith Ealing Hounslow Fulham Mind team and the work and support we get from that team. Really great for us in terms of their engagement with our learners. Historically, We've had issues in terms of accessing services like CAMS and other statutory services external to us. The approach that the Mind team take and the way they work and their willingness to engage over a longer period of time has really been what our learners have responded to. We are, confident that the work that the team are doing with our learners will stand them in good stead for the long term. So we're ultimately extremely grateful for the support that we get.
I think for Latimer, the professional relationship we have with HMST, with the Mind team, with the therapists has been invaluable. It's very much seen as part of our team, as part of our offer. I would fully endorse any school or educational setting that hasn't worked with them to take up that offer in the service. As a fairly inexperienced SENCO, I cannot stress enough the support that I have found from them. They have such a range of experience and they're very generous with their time and the advice. And as I say, they feel very much like part of our staff team now, and they are absolutely essential to our offer.
It is always a pleasure working with Hammersmith and Fulham Ealing House and Mind, and it's great for services to pull together their strengths to provide a greater offer of support to young people. A fantastic example of this is our joint workshops, which are running across this academic year. These workshops are a universal offer to all of the schools in Hammersmith and Fulham, with the first being on managing emotions that happened in October. This was really well attended by 12 schools and had some great positive feedback. Along with this, we will work together to help reach as many young people and schools in the borough to help raise awareness on the importance of mental health and where young people can find support if they're in need.
We've been fortunate enough over the past 18 months to work alongside HFEH Mind, delivering some unique pilot programmes in our schools at Chelsea Academy and Fulham Boys School, as well as doing some workshops around Children's Mental Health Awareness Week and various events with our academy players as well. This has given us a real insight into developing our programme further, and something that the young people and students and schools have been fortunate enough to have access to. We can't thank the staff at HFEH Mind enough for bringing their expertise and advice towards guiding our programme and young people forward in mental health.
Getting excluded and going to improve can really affect your mental health. You'll struggle with feelings of rejection, self-esteem and self-worth. Staff from Hammersmith and Fulham Mind helped to improve my mental health by listening and getting to know me, by offering practical strategies that I can use in my everyday life to lift my mood and confidence. Staff from Hammersmith, Fulham and Mind really helped support and get me through the negative feelings of being excluded from school.
The workshop gave me a space to talk about some of the problems that happen in school life, such as the tragic events of George Floyd's passing, many more stuff as well. It actually makes you able to talk about it, which most people won't be able to do with young people like me. I think everyone should give this charity a chance, as it will help you a lot, and I actually mean a lot.
Thank you.
Yeah, and we've come to the end of the presentation. So yeah, just to reinforce in terms of that video, just reinforcing our values that we work by. That's it. Thank you.
Thanks very much to all of you. And it seems really appropriate that our last presentation should end with the voices of young people, and I think it seems like a really fitting end to the session and to the presentations. Sheena, I'm going to hand over to you around question and answers if we have any. So I'll hand over to you now.
Thank you very, very much. So that brings us to the end of our presentations, and we wanted to just spend a little bit of time thinking with you or reflecting with you about any thoughts you had about today's session or any of the presentations, or any questions which may not have been covered in the chat. So it's just an opportunity to hear from you before we ask you to just do one final activity for us, which is a word cloud before we finish. So are there any thoughts or questions that anyone has? There may not be. There may be that colleagues feel things have been covered through the chat as we've been going through. Well, shall we move into the? Oh, I can see somebody's got their hand up. Hannah. Hannah, I'm not sure if you're on mute, but we can't hear you.
She's saying Hannah can't seem to get her mic working, she's saying.
Ah, okay. Hannah, is it something you want to pop in the chat perhaps, and we can try and respond to it maybe?
So
something about the early intervention, emphasis on early intervention and treatment. Oh. Oh, somebody's saying all participants are muted. So I'll try. So yeah, sorry about that. I'll try and summarize what you're asking, Hannah. There's something about early intervention and treatment, and you're talking or thinking about the lack of focus on preventative work and social inequalities.
I might have just been able to unmute Hannah. I'm not sure. Do you want to try again? No, maybe not.
Hannah, no.
Sorry, we are trying.
Okay, I think Hannah, what you're describing is that there needs to be more thinking about an individualized approach rather than a kind of public health approach to tailoring care a little bit more. I think that's what you're suggesting or sharing as a thought. Yeah, I can see somebody else has got their hand up, but I don't know if we're going to have the same. Oh, it's still you, Hannah. Did anybody have any thoughts on what Hannah was sharing? No.
I suppose actually no, I think there's it's what we have been thinking about is the implementation of the Thrive approach across London. Because I think that is much more, that implements much more of a sort of public health approach where we're thinking about the giving advice and the getting helps sort of aspects of the quadrant. So I think it's a fair point, Hannah, and one that I think we need to do more to address how we have a public health approach, and one that I think really does sort of address some of those fundamental inequalities that have a serious impact on the emotional well-being and mental health of young people. So I think good point. Thank you.
Absolutely. Thank you very much, Ian and Hannah, for raising such an important point. Shall we move on into just getting your thoughts about for our words cloud? So the question is, which we'd really appreciate your thoughts on, or your words on, is if you could just let us know your thoughts and feelings about the Mental Health in Schools programme in London. Thank you. We'll give you a few minutes just to input your thoughts. Some really lovely and powerful thoughts coming through. Amazing, needed, comprehensive. Really, really helpful and so relevant to where we are. we'll give people just another minute or so before we move on. People are saying there's some brilliant work, excellent examples, really lovely. Okay, that's a really, really helpful kind of temperature check for where we are, and that probably brings us into the final element of our session today. So Ian, would you like to start? Shall I with just some final words, or would you like me to? I'm happy to.
I'll yeah, I mean, I think people have reflected. I think we've had to pack so much in because actually there's so much going on. You know, a huge amount of information that we've heard from the presenters. I suppose I'd like to thank everybody for attending. I'd like to thank all of the presenters. And I think, you know, just going back to that context of where we, has been happening the last 2 years and the pressure that's had on schools and school leaders and all of the staff that work in schools, but parents, carers, but most of all children and young people. And I think it's just I think we need to keep in mind just how much all of those people have done to come through the last 2 years and all of the pressures that's been upon them. But it's just marvelous to see so much work going on, and really encouraging. Lots more to do or as ever.
Thank you very much, Ian, and I would absolutely echo that. I really hope today has felt helpful and enabled us to kind of celebrate and reflect and to share. You know, there's such a huge amount of work going on, and you know, we're not out the other end of the challenging kind of COVID times, and people continue to kind of work incredibly hard during the times that we've got, and I really hope that it's felt as helpful for you all today as it has for us.